like
Good evening.
Quiet.
It's like we have to wait for the light to come on.
Oh,
so
okay.
Sorry for that awkward silence. But we are ready to begin. We have one item on tonight's agenda, and I will turn it over to our speakers to present on our comprehensive crisis response proposal and background information.
Madam Mayor, brief introductions. Mr. Jeff Dismukes from the State Department of Behavioral Health and Substance Abuse will introduce our team of personnel and supporting agencies that do currently take care of people in behavioral health crisis here in Norman, with some wonderful information to share with council that we think is going to hit your mark to the letter. Jeff.
Jeff Dismukes, I'm Director of Communications for the Department of Mental Health and Substance Abuse Services here at, and I live here in Norman, and pop around every once in a while to talk about things. But this is one of the issues that I know is really important to Norman as far as behavioral health, addressing the needs of the community. It's something that's very close to my heart. And we have several people from the department. I'm not going to spend any time talking tonight, but they will be able to and tell you a little bit about what we have going on that I do think probably meets some of the things that I've heard from the council as wanting to do. Back down on the end, we'll just go around. Shamika Williams is the interim director of Central Oklahoma Community Mental Health Center over on Alameda. Shamika is probably one of the most caring, innovative people that I've worked with at the department. I've known her for years. She is the architect and creator of the Children's Mobile Crisis System for Oklahoma, and that has been hers. She's fought for it, and we're up statewide, and incredible results. Jessica Wisdom up from central office. So Jessica Wisdom used to be at Griffin. We almost lost her, and we were able to keep her by bringing her up to central office. And Nisha Wilson over here are the people that we have work. Well, they do everything, but I'm going to summarize it down to this for right now. They're part of our development of a comprehensive crisis response system statewide. That is going to include a state call center, all of our mobile crisis services, and a continuum of services that feed into that system. Teresa Capps from the Children's Recovery Center. I think most people know who Teresa is. She has been doing incredible work in Norman for years and for the families of this community, for children. And did I forget anybody else? Oh, and just me. And with that, I'll go ahead and turn it over to the presenters.
Thank you.
Thank you.
Well, thank you very much for having us here today. We really welcome the opportunity to share all of the great work that we've been working on over the last several years, especially this exciting initiative and these programs that we want to put in place here in Oklahoma. So again, my name is Jessica Wisdom. I am a Norman resident and have been for 16 years. Moved here from Washington State. My realtor said that I would never leave Norman, and I did not believe him, and here I stay. So here I am, and I've worked at Griffin for 15 years. Recently went to central office in this role, and am very, very excited about working on this project. So I'm going to send these around. It's going to be a slide also, but if you guys want to take any of these back and to share with your folks or to have for yourself, I'm just going to pass them around, take as many as you'd like. So before we start the slides, the entire purpose of what we're going to show you is to meet people where they're at, to meet the patient exactly where he or she is, and to provide the services that allow that person to become stable as soon as possible. The idea is diversion. So we want to move. I love Griffin. Again, it's where my heart is, but that's not where we want patients. We want patients in the mental health center. We want patients diverted into stabilizing, ongoing, consistent care where they can have the same doctor, the same therapist, they can have the same treatment providers, the nurses, people know their name, right? Cheers, here we go. And so we want to move people into a place that they can have good health for years and years to come, if not a lifetime for some folks. And so everything that's been set up here has been years of development, and is really in place for that purpose, to divert and to meet people right where they're at. So I'm going to go ahead and this is really, in a nutshell, what we're here to talk about. So the call helpline. Now, this is something, whether we're sitting at this table or in a mental health center, that we need to know because it's as important as 911. So starting next July, 988 is going to be the number that anyone in the nation calls when they need mental health help. That is just fantastic. For Oklahoma, for our entire nation, for every single state involved in this. It's absolutely fantastic. Now, it means absolutely nothing if you call 988 and it goes nowhere, right? Because we need to assist people and help people. And so we are putting together a call center. And that call center is going to serve the entire state of Oklahoma. One call center, one company is going to serve the entire state of Oklahoma with the big goals of de-escalating the caller. So if I call in a crisis, the person who answers the phone, their first goal is going to get me to hopefully come down a few notches to a place that I can have a conversation and really identify my needs. Not so much my emotions, but my needs. Those needs are going to be met head on. Can we talk for 30 minutes and then I connect you to your friend or family member in the community? Can I connect you to a mental health center appointment the next day? Do you need some medicine? What is it that you need right now? Do you need to be connected to a med clinic? I can connect you to that right now. Do you need substance abuse treatment? I can connect you right now, okay? If something goes beyond the ability to help de-escalate in that time, we have a number of other steps that we're going to put in place. The next step is that we can connect directly to mobile crisis, which is going to send a team to that place where that person is. The park, a grocery store, a home, anywhere that person is in the community, a mobile crisis team is going to be sent to that location to help, again, to divert and to de-escalate. Always the goals, okay? Meet the person where they're at. So they're going to get there and they're going to have now a face-to-face conversation. And the whole entire goal is to just assess needs and to put the next piece into place. Can I now get you an appointment to the mental health center? Can I now get you connected to your family? Or do you need the next step?
Ms. Wisdom, would you prefer we save questions for the end?
I am absolutely open to whatever.
Okay, well, I'll throw it at you then. What is the mobile crisis team made out of? Is it law enforcement? Is it?
So again, the idea of diversion fits into this because we are also diverting away from law enforcement. Okay, so the 988 takes away from dispatch. So the first engagement is to mental health providers. Our goal is to stay on the track of mental health providers, to stay away from law enforcement. There are going to be times that law enforcement is absolutely necessary to help us engage because the person is dangerous to themselves or others in a way that our mobile teams are not prepared to handle. And so there will be times that we absolutely will need law enforcement to help us out.
So it's not a set team. It's not like, we refer often to the Kahoot model where it's could be a law enforcement and a mental health response, so it's not set, is what I'm asking.
That is not a guarantee, no. It is not set. Every time mobile crisis goes out, it does not mean that law enforcement goes out. Actually, in fact, right now, the RFP that we're working on has a case manager, a therapist, and or an RSS, a case manager or an RSS, which is a recovery support specialist. And that person is a person with lived experience where they've had the crisis. They've been in severe substance abuse. They're going into the community with the therapist in order to engage somebody in a place that they've already been at. And so that's our ideal pair that will go into the community. Now we can also have a case manager because sometimes RSSs just aren't going to be available. And so those two folks would be the ones making the contact. And if they need to engage law enforcement or first responders, if it's a medical emergency, they will be comfortable in making those phone calls and engaging those other entities, those other folks. So, okay.
Councilor Studley?
Is that call determined after they arrive on scene and assess the situation, or is that determined from the 988 call?
That's a very good question. So 988 is very connected, has the ability to forward calls to dispatch, to 911 dispatch. So if it sounds like in the 988 call that it's going to be something that's just above and beyond our ability, it can be forwarded straight to law enforcement and for them to engage right away. And so it just kind of depends on the situation. Again, the fabulous part about this is it's all tailored to this call right here. It's not a one size fit all. It's not a cookie cutter. It's a tailored to the person. And that's why the continuum is so important, because we need all of these pieces in place in order to meet the need. And again, divert away from hospitalization. So mobile crisis team, I should have remembered. I should have put a pin in where we left off. So I'm gonna go back and try to remember that. But the mobile crisis team, if they are unable to de-escalate the person, they can offer that person the opportunity to go to what we call an urgent recovery center, which is a URC. Now, the nice thing about the URCs is we're already very good at URCs in our state. We just don't have enough of them. So part of our funds is to increase the URCs around the state. So URCs, it's like a 23-hour, 59-minute recovery chair where you go. You can see a nurse, you can see a physician, you can or an APRN. You can be prescribed medications. You will see a therapist who will be assessing your needs the entire time. If again, with the goal of individualized treatment and diversion. So we want to. The goal is to not put somebody into a crisis bed at this point. Okay. However, if we need to, we're going to put someone in a crisis bed. So those beds are also going to be available. So we have crisis centers currently in place. We do that very well. Again, we would just like more of them. So some of the money and the initiative that we have is to put more crisis centers in place around the state. And again, the goal is to meet the persons where they're at. This is how it goes at every level, and to divert. We don't want people going from crisis centers to hospitals. We want everybody to be treated where they're at and then diverted to the mental health center from there. So everybody leaves all of these different points with a mental health center appointment, a transition plan, connection to care. Then the next level that receives the patient connects with that patient within a certain amount of time. The group that's handing off the patient also connects with the patient within a certain amount of time, so that we are helping this person channel this person into the right place. We're not just letting them go and saying, good luck, get to the appointment tomorrow. That's not what we want at all. We want to follow up. We want our personal relationship to help that person engage in care. And then of course there's hospitalization. And that's our most, the highest level of care, of intervention. So the other piece of that is, how do people get here and there? How do they get around, right? So the piece that you're going to see of this that goes into place first is going to be this coming November, and you guys probably know some of this already. But the transportation piece of this is that, so law enforcement, our NorMPD would pick someone up in the community, decide, oh my gosh, this isn't a domestic issue, this is actually a mental health issue, and they would take somebody to Griffin, Red Rock, Central Oklahoma for evaluation. If that person needed the higher level of care, we would have a private transportation company transfer that person to the next place. So again, diverting from law enforcement. There will be times when law enforcement is absolutely the only safest way possible to have this person transported onto the next level of care. And so there will be those periods. Our goal is to divert a large percentage of this away from law enforcement. Let them do a totally different job, right? Let us do ours. So that really is our continuum. And it should all be in place by July 2020. So we have a big task in the next year, a very big task. Currently, there's an RFI out for the helpline. We're currently putting together the RFP for the mobile crisis. So all of those pieces are actively being put in place. So, did I miss anything? The what?
Transportation.
Yeah, that's number 4, right? So the transportation bill that changes in November. That's a piece that we've been funded to contract with the private agency to provide transportation to law enforcement.
Councilor Studley?
I was going to ask you to go into a little bit more detail if you could on that. Can you tell us a little bit more about the law that's changing in November?
So I'm going to let Jeff take that on specifically, because
I was waving at her because I'm not really sure if she knows. There are additional slides.
Oh.
So were you going to go through them? So I'll give you guys, and to help a little bit, I was going to kind of help clarify, I apologize for jumping in, but one of your questions was, I think what you were asking is, is this team, a set team that comes out. Definitely, it's medical professionals. It's, Nisha, how do we set it up? It's clinical and a peer?
A licensed therapist is part of the team, and then the second person can be a case manager or a certified peer recovery support specialist. So it's a team of 2 people that are mental health professionals that are responding as part of the mobile crisis teams. Yes.
Thought that would help a little bit, but you might go ahead and cover it this way, Jessica, so you have all the
Okay,
slides.
so I'll just go through this this way. Sorry.
It's okay. I'd go back to the start just so that.
Yeah. Okay.
Yeah.
So this is the screen that you guys have in front of you also, and then the overall here. It really speaks to a lot of the stuff that I've already talked about. I just haven't shown the slide. So that really our emphasis and our focus is on best practice. It's on meeting the state's needs. It's on working with, SAMHSA and other national organizations that have done this stuff before, that have put this together, that have defined a structure for best care.
No, go for it. I think one of the most important things to identify is this model is not just something that was created by some individuals. We're talking about a national model that has been vetted. There's science behind this, around this crisis care. SAMHSA, which is our federal organization, has put a stamp on it, as well as worked with other professionals across the nation to come up with these types of models. And so this is not something that was an idea by the state or an idea by other individuals. I think that the team has really worked with other professionals to tailor it to the state of Oklahoma. This is a statewide operation. When I say tailor, we have to think about aspects such as rural and frontier areas as a part of our model. And so I just think it's important to know that there is science behind this.
So the third bullet point stands out to me. Funding has been appropriated for components in addition to annual funding for treatment and support services, state, federal, and reimbursement. We live in a state that doesn't always fund social services, which then ends up at our doorstep. So how are we sure that we're not going to end up picking up the tab for this in tight budget times when oil's rough, or pick your excuse in Oklahoma?
The really nice piece that's kind of come along at the same time and fits really nicely into this is Medicaid expansion, and our facilities are working diligently to sign the folks up with serious mental illness, with compromised medical conditions, into the Medicaid system. We complete applications, we help them, sign up for that. And so we hope that not only can we help people get connected to mental health care, to get funded for their mental health care, not walk away with a bill, just like you guys, end up with bills. Folks like Griffin, our facilities, we have to write stuff off all the time, and so we think just like you do, like how can we get insurance to help us here? How can we get the Medicaid to help us here? And so we're actively thinking in the same very way across the state, because the more we're able to bill for services, the more we can do for the state anyway, right? And so so that's an active part of our process.
Can we go back to my question? I know that he wanted you to go through the slides, but I really want to know what the state law is that changed in November.
Yes.
And what the private transportation piece is.
Okay,
I'm sorry. She was.
Do you want to speak to that?
You go ahead.
I'm happy to talk about it. Hi, I'm Nisha Wilson. So there was legislation that passed this year. It was Senate Bill 3. That specifically gives us authorization to contract with private entities or entity for what's called secondary mental health transports. And that's what Jessica was describing just a couple of minutes ago. So essentially what that means is once an individual has been assessed as needing hospitalization or a crisis bed, and that bed is more than 30 miles away, we now have the ability to contract and pay for a private transportation entity to make that secondary transport over 30 miles. So that legislation was passed, and then we also received state appropriations to fund that. We will be issuing contracts through a competitive process. We'll be issuing an RFP very soon. And that legislation actually goes into effect on November 1st, and so we want to have the RFP and the contracts well in place before then.
Is the legislation specific about the 30 miles, or is that your policy?
I believe that
Legislation
the
specific.
legislation was specific, yes.
Thank you.
Just to clarify on the funding, the third bullet, where it says reimbursement, this is their ability to figure out if the client is insured. And they already know how to do all the billing, and those are things we don't really have a clue how to do or have software to do any of that. And it was a thing that really hadn't entered my mind until these folks shared this information with us. But I mean, that could be a third of the funding for the whole program, as long as everybody knows who's insured and how to go about accessing the insurance coverage for the services they're receiving. So that was just a huge component of making sure this does stay funded.
I think it's a combination of things. I think at this particular time and in the state of Oklahoma, I think we have the best of a couple of worlds. We have federal funding that has come in to support things like that. Our state legislators provide additional funding, and then the opportunity for Medicaid expansion. Saying what you said, again, I think that our mental health treatment providers are able to identify those individuals that don't have Medicaid and help them to access that when it is identified. And so I think that you have a combination to get it right with this funding that's coming to us now. We have an opportunity to get it right and kind of mold it, shape it, and still yet have an opportunity to sustain it long term.
Thank you.
Councilman Berlin?
I do have a question. We might be skipping ahead, but on these teams, they're set in county locations? Is that?
Are you talking about the mobile crisis teams?
Yes.
Okay.
Is it? How's it designated by what area?
So currently, the designations have not happened. That'll sort of come through when the RFPs come back and that we contract with folks. Ultimately, the Department of Mental Health would like everybody to have contact mental health services within 20 miles of wherever they're at. And so there's like this really big long-term plan. And this is definitely the first, there's the first wave of that. But as we go along and as we build services in Oklahoma, we will just continue and build out. And so this is, at this time, that they haven't been identified exactly where they will be.
So I don't know if you know this or not, but for Cleveland County, say, if it's by county designation, how big of a staff would have to be in Cleveland County to man that? Because if you have, you have a team, is it running 24/7? Mm-hmm. How many teams does it take to do that, and what do you do if there's one call here and there's one call,
So that's
elsewhere in the
a
county?
Really great question, and so thanks for bringing that up because I didn't address it. The teams, when the folks present their RFPs, when they submit them, they're going to say the area that they're proposing to be in and how they plan to cover that area. So everyone could be a tad bit different. Even like right now, the sizes of our crisis centers vary. The number of crisis centers vary depending on area. Like in Oklahoma City, we have 2. And in Norman, we have 1, but it's the largest crisis center that's there. And so it's going to depend on the area. It's going to depend on the size. That's not completely decided until all of this kind of plays out. And so it's going to be a puzzle that comes together. And, we don't have all of those answers right now.
But I think to add to what you're saying, as Jessica mentioned, best practice within 20 minutes or less. And so again, thinking about how a team or multiple teams will be deployed through Cleveland County with the idea of how will you plan to get there within 20 minutes or less. And so those are the types of things that will be placed in the RFP where providers or individuals or entities will have to address what their strategy is. When you think about the how many teams? Again, we have data in our system. We have data that will provide us with, the number of crises that have come out of Cleveland County over the last couple of years, whether it been mental health crisis that we've seen at our community mental health center, or whether it's been crises that have actually come to our front doors of our crisis centers across the state. And so I think that we have things to look at to make plans. I know that there is a tight connection with 888 and 911, and the number of crisis calls that come through that are not that are mental health related. And so I think it'll be, again, a combination of looking at the data that we currently have, but building out over time to be able to determine what the need looks like.
With this information that came, from National Model, is there something that says, here's the team, here's the average time of, because I'm guessing that this is probably going to be like 2 hours a call or something like that to get this, if you're going to get them to mental health and stuff like that, you're going to be involved for a little bit. It's not just showing up and making an arrest like the police and dropping them off at the jail or whatever like that. You're working this issue for a little bit. So is there something, a data set that said, here's our average time per call that we've spent on this?
Average episode. And so I can't, again, I am not well versed on the this part of what the data says, but I can tell you from the Children's National Model, there were recommendations that were made by the feds in order to make a determination for, distance and expectation around how much timing it would be. We do have what we call episodes, and the episode is anywhere from 30 minutes to an actual hour. Here in Cleveland County specifically, along the children's arena, we have a crisis team. But when in fact that crisis team is deployed to an incident, and even in today, we have other individuals that can back that team up. And so I think over time, it's one of those things, because initially, what we've seen in our children's system when we first launched it, there was very minimal. But again, we built to over 8,000 calls from within 3 years, and so our capacity is much greater. And so I don't know if you want to address it specifically from this model and
Yes,
what's
thank you.
recommended.
And if I may, I do think it's important to remember that this is really about a continuum of care. So what we do know from national models and the research is that about 80%, probably a little bit higher, of calls can be addressed at the call center level. So we know that we will receive a number of calls that are resource type questions. Where can I get access to mental health care? My family member needs mental health treatment. Where's the nearest mental health center that I can get treatment services at? All the way to very acute calls, individuals in need of de-escalation and intervention for suicide risk. So we do know that the national models show that 80% or more of calls can be addressed at the call center level and will never need a mobile crisis response. So that's a really important piece of the continuum, that you're absolutely right. Without a call center, the need for mobile crisis teams gets very overwhelming very quickly, because then that team doesn't have an ability to prioritize calls and address calls over the phone, and they're going out on everything. So it is important to think about the continuum as it fits together. Those calls addressed at the call center level, and then mobile crisis teams. What the national data shows is that one mobile response team can handle somewhere between 4 and 6 calls per day. And that's been the national standard. Certainly that's going to vary from day to day and by location to location, but that's about the average that we see. So certainly we'll be looking at that whenever we release the RFP and look at contract awards, along with all the data that Shanique is talking about as well.
You know,
Great question.
I'm glad you mentioned the call center, Nisha, because I think that's a really important factor. The call center are going to be staffed with licensed clinicians, and these licensed clinicians will have the ability to talk to individuals who may be in crisis, but they will also have the ability to schedule these types of appointments for those individuals. And I think that majority of individuals at some time or another, they want, it's not necessarily a crisis that results in a safety. It's really about, for them, it's a crisis and needing individuals to have access to really talk through those moments.
Thank you.
There is also a request on our end that if the need changes, we're asking the mobile, the call center RFIs and the information in the RFPs for the mobile crisis. How are you going to expand if the need is there to expand? So that is built into this also, is that we get that it's not going to be, every day is not going to be the same.
Right.
And so that's in there. Yeah.
All right, we have Councilmember Schuler, Studley, and then Hall.
Okay.
Thank you so much for doing this. I know that if you've been paying attention, we've been kind of having an outcry in our community for the need for something like this for a while. And so, we've appropriated money for this and trying to build out the system for ourselves. But, seeing what's going on at the state level, and that this, is getting a lot of attention and a lot of, resources and money and things. My question is, how is this going to be incorporated with local municipalities? Like, how is that coordination going to happen, and how is that going to service since it is a statewide program and you're still building it out, I realize, but what does that look like in terms of how it gets incorporated for us, and how do we think about strategically implementing something like this with the state?
That's a really great question. And again, I think that in every county, in every city, it might look a little different. But we're definitely working with all of the treatment providers in those areas and all of the associated groups. Like, we've come together in this county a number of times, and the folks that our mental health team and law enforcement and transition house and club, Thunderbird Clubhouse, like all of these folks work together. We work together to make this happen. And so we're just going to continue to do that like we do all the time together to implement new things. I mean, this will just be another piece of that puzzle. And so we will definitely include those other agencies here in Norman, and see how we'll work with Bonnie when she has a crisis, how we can get people there, what we can do together, and we'll just move forward like that. But we definitely have plans to, educate the community and to educate our treatment providers and to make this work.
Sure. I guess what I'm asking is is there a plan type, some kind of task force for each county, or are there going to be public meetings to get information out that this service is coming, that to provide education for the community, but also for our local law enforcement and other public safety officers? What does that look like?
I see Nisha back there nodding her head. I think that she might have the better answer than I do.
So what I would say is it's going to certainly be a mix of both state and community-driven efforts, and I think that's going to be absolutely necessary. And so we will absolutely be doing a big push from our communications office, and I point to Jeff because he's our communications office. We will be doing a big push through our communications office on the rollout of 988, specifically around Oklahoma's crisis continuum of care also as that gets closer. We know that there will be big pushes federally as well. There's been a lot of conversation from the FCC, from SAMHSA, and from other federal groups on strategies for communications and making sure really the country is aware of 988 coming on board in July. And then also that's going to be really important for local municipalities and counties themselves to really look at who are our partners in that continuum. So I talk a lot about us wanting to roll out RFPs and do competitive processes to identify who those local community partners are. And certainly I think that's going to be a really important piece for those community partners to work directly with the folks that they already have relationships with in their community, so that the citizens in their municipality and in their county are aware of the resources that they're providing locally. So I do think it's going to be all three pieces that are going to be really important.
Can I add? We already have in Norman a mental health task force, meets on the second Friday, as well as a children's resource team meeting. Really well attended.
Thank you. Councilmember Studley?
You had mentioned that 988 can divert calls to 911 if the need for law enforcement. Can 911 divert calls to 988?
Absolutely. 100%.
Is that something that is kind of written in the language somewhere, or through your partnership with 911?
Well, a number of the cities and counties will have a call center person in dispatch, and so they'll be working very close together, depending on the area and the situation. So absolutely, we're gonna have a close relationship. And here in Norman, we have mental health and law enforcement have a very close relationship already. And so this is just going to be one more thing. It's an enhancement to the relationship and another tool that the team can use together. But there's going to be clear communication back and forth.
So then, are you saying then that the 988 dispatch is going to be in the 911?
Well, there'll be
center?
some of the counties there'll be a person in a dispatch area. There's going to be there may not be the entire call center may not be in every county, right? We're gonna have to build those in. Nisha, you might want to speak to this more than I am right now,
Sure.
but
yeah, absolutely. So yes, there will be communication, and that is a national standard. And really, what you think about as a 988 call center is not just a I pick up a phone call and I talk to someone. It is a very high-tech dispatch location for call centers. And so we will be doing things like requiring GPS tracking of mobile crisis teams so that we will be able to see where responses are, how far away those responses are. We have already involved the state 911 office and a couple of local 911 PSAPs to talk about and learn more about their system. We want them to have input into 988 system so that we can understand each other's responsibilities. We certainly know that that's answering any call that is transferred from 911 is incredibly serious, and those are life or death calls. And so we know that they have national standards and practices that they have to meet, and we want to make sure that we understand those through our competitive bid process for a 988 call center. So we absolutely, there are already states that have those types of connections and do a tremendous job on those. And so we're learning about what's already in place. What did their decision trees look like so that we can sit down with 911 offices and look at what decision trees are in place right now for when we know it will happen, no matter how much communication we put out in the heat of the moment. A 988 call will come in and it should have been 911, or a 911 call come in and it should have been 988. So we know no matter how good of a job we do on the communications end, we absolutely have to have that really great technology that links those two up so that they can transfer back and forth. And that has been received incredibly positively because, as Jessica mentioned, when they look at their data, right now, 911 is receiving a huge number of mental health crisis calls, and we know that when law enforcement responds to those, because they have to when it comes through 911, we know that through law enforcement's data and through 911 dispatch data, that many times that was a call that was truly a mental health crisis and a mental health emergency. And so just off the top of that data, we know that there are a significant number of calls that we can take directly off of 911 into 988 or transfer those calls directly through that connection that you're talking about so that we do have the purely mental health response instead of the law enforcement response.
And that's on the mobile end too. If law enforcement goes into the community and responds to a domestic violence or some kind of a situation and they realize, oh, this is really mental health, they can call mobile crisis to come and so they can go, So again, it's going to not only happen at the call center, but it'll happen at the mobile level too.
Councilor Hall?
Yes, thank you. And thank you for taking the time to bring all of this to us. This is, incredibly important piece of the puzzle, and encourage that we've got increased funding for an area that we all understand needs a robust attention. And really, both of these lines of questioning sort of fit right into several of the things that I'm wondering about too, and most of it is about how it actually all fits together. So this is and the government jurisdiction and authority, I guess. So this is all being coordinated out of the State Department of Mental Health at the state level. So how, and this may be for you too, Chief Lester, so where is the 988 call center? Is that under the authority of Cleveland County, or is that going to be under the authority of the city of Norman?
So it's going to be a private company.
Okay, a private
that's
company.
Contracting with the Department of Mental Health to provide a service.
Okay, through the state.
Through the state.
Okay.
So we will fund their service. They
Okay.
will provide the service, and we will ask for certain things.
Okay.
For them to provide us data, for them to provide us feedback. We will monitor the use of that center.
So will that center just basically be a call center someplace in Oklahoma, or are these all going to be built out to?
There will be one in a center, but then there could be pieces of it in other counties, right?
Okay.
Like you might. Yeah.
So currently, right now, in our children's mobile crisis system, we have a call center that's located in Tulsa and one that's located in Oklahoma City.
Okay.
Both of those outfits, when calling that line, have the ability to do one transfers to law enforcement, medical, police, fire, however, for them to get there. But they also have the ability to transfer to 211, which is kind of a helpline. And so these outfits are so technically sound that they are still there, handing off, connecting with the entities safety entities or however, if a person need those things.
Okay, so it's currently set up that way for the children's
On the-
response unit?
Right, that's an example
Okay.
of how it potentially can be.
Okay, so I guess that's really what I'm wondering about, what that flow chart is of you get the call in Tulsa or Oklahoma City, and it's something that's occurring in Norman. Then how is that how is that diverted at that point?
So 211, the Heartline currently has a system that connects to the 911 system. So if a person is calling in from Norman, they have a direct line contact to Norman Police Department if that person needs to be aided by the police department. And so it's as far as on the tech side, how that happens, it happens pretty immediately, but I don't know the details as to what the technical.
No, I'm not really trying to get the sense of the technical interface. It's just where do these calls keep being handed off? And you actually addressed one of my other questions was, how does this all interface with our current 211 number? And how's that going to work going forward?
Well, I can't answer that directly because
Okay.
the RFP hasn't been out, but I'm hopeful that there is an interface. I know we've talked about the interface because, like Nisha mentioned earlier, a lot of individuals are in crisis because they have a basic need that is not met, and we have a system such as 211 that's able to meet those individual needs, and so there will be an interface. But as far as how that interface will look, I'm not completely sure.
So the actual teams of people, you said primarily it would be 2 people, and it's going to be some type of licensed professional plus a, what you called it, resource.
An RSS or a case manager.
Resource support specialist. So that's your response unit basically. So I'm trying to understand where the jurisdiction begins and ends. Is that a municipal function? Is that a county function? Is that a state? Who is that? And who are they reporting to?
So again, they're all going to be private agencies that are contracting with the state.
With the state, okay.
Yeah, that are, we provide the contracts, and that we receive data as they work and as they function. We monitor their function, and we provide a payment per service. But we also want, again, any private insurance, any Medicaid, any reimbursements outside of that process to be used in terms of reimbursement. So it should not fall to the city for the functions that we're talking about today.
Okay.
That's probably why we're a little late in giving you this information, because it doesn't involve you. So sorry for the late conversation, but we do plan on providing that coverage. Yes, as a Department of Health.
Okay, so again, that resource team or that response team, are they people that are actually living here in Cleveland County, or are they being
So again,
part of the continuum of care team? I mean,
so if it's the mobile team that we're talking about here,
Yeah.
we want them located here
Cleveland County.
in order so that they can go into the community and be there for people in their need, in the crisis at that moment. So yes, absolutely. The phone stuff, again, we haven't quite nailed all of that down, but the phone stuff, because it's telephone, it doesn't necessarily have to be located here in Cleveland County, but it can. We'll see how those chips fall as we go forward. But the mobile teams will be designated to areas.
okay.
Yeah.
And then is that up to the State Department of Mental Health to determine how
So
many
part of it
teams
is-
you need per area?
Yeah, we've looked at a map in terms of where the needs are, and we've collected that data. We put it on that map. It's kind of neat to see like where people come from in terms of service, and so we will try to tailor this. Again, it hasn't been defined yet, so to give you an exact answer, I really can't do that. But the goal is to put these teams in place where they're most in need at in Oklahoma right now. Like we're looking at that, we're tracking that data. We want people to have services, and it not, again, task our law enforcement and even task our transportation, company that we put into place. We want services to be easy for the consumer on down. And so we're really going to work towards that. We just don't have all of those pieces yet right now.
Oh, I understand that. I really do. I'm not trying to pin you down to all of that, but I guess from where we're sitting and with the challenges that we have identified in our community this year, this is, I think, a pretty fundamental shift in how we're thinking about delivering improved mental health services in a positive way.
Right.
But I think for right now, for the city of Norman, those 911 calls are going through the city dispatch system, through our Norman, police department for fire and emergency service and everything else. And so it's trying to figure out, where that handoff is taking place. And so I understand what you're saying about, this is a tremendous education opportunity, really, but I can see where rolling it out, getting it in place, that's going to be a pretty tremendous undertaking. Obviously, you all are thinking about that, but for how we're moving forward with how this all works, this is it's a pretty big shift.
Yeah.
And so I am assuming that we've had our city departments have been in these conversations and know what's coming.
So, Councilmember Hall, and actually we just got this party started last Thursday, and
Okay.
this team sprung into action and just put us in a sense of shock that I think they watched the council meeting that you discussed this, and then here they are. When I asked each of our current service providers, where is it that the city of Norman helps us advance this model that council was kind of somehow defined in advance of knowing what was already happened, and the concept of community outreach and public education is a thing we're pretty good at. And I started to think about whenever, we're going to have a conversation about a street maintenance bond, and we have a team that meets with every Rotary Club and church groups and Kiwanis, and we're out and we're sharing that message, and we're inviting questions and making curious minds look with us towards these answers, that these folks will help us put together the message as RFPs come together and we start putting the puzzle pieces together. And I think council's ability to direct staff and participate in public outreach and education, and I can imagine it's, things from Facebook ads popping up. If you're a Norman Facebook user, some of those commercials coming up between could be commercials we put together to help educate you about, in these circumstances, don't call 911, call 988. All this is going to be effective July 2022. It's coming. And are you experiencing these problems at home? Here's somebody you can call. We can do it. Take the road show out to the people. We've got a lot of social media access, even utility bill stuffers that go out to every household in Norman. It's a thing we could do, I think, better than most of our neighboring agencies. And with recognition that we have resources like Red Rock and Griffin and the children's facility here in Norman, we really do have a vested interest in making sure everybody knows how to access those services in the most efficient manner possible. So I was relieved that where this team thinks the city of Norman can help most is something that we're actually pretty darn good at.
Well, and that's my kind of the next question is, what are the gaps that aren't going to be covered in this
Yes.
operation, or the way this functions, that the city could also play a role in to fill those gaps. So my example is going to be, this is primarily focused on whether you're having a mental or behavioral health crisis. So we get a lot of non-emergency calls for other things that, also require outreach and intervention, and particularly when we're addressing our unsheltered neighbors here in Norman, and that might not be described as a mental health crisis, so it's not going to fall into this bucket. How's that going to work?
Darn darn good question.
I think that is
So
a
I
darn good
think-
question.
Inquiring minds want to know.
Yeah. And I think that's, as I think about the crisis continuum, we're talking about individuals that are in some aspects of severe need. And so when we think about those state and federal funds, and we think about DMH and their role in making sure that no one is left in crisis. So regardless if they have a Medicaid payment source, if they have private insurance, again, the infrastructure for this crisis continuum, and then of course the dollars that are coming in are there. I think the areas that we have to really think about is those that are specific to Norman and what is the needs in Norman. And so when you think about crisis, you think about a continuum that's kind of like a moon. But then there's also outreach, there's also access, and there's also recovery. As I have been following the meetings, there's some things that I asked this question the other day. I think we're talking about a combination of things, and we're talking about a melting pot of homeless individuals who may or may not have mental health illness. And we're talking about other individuals. We're talking about a community that is concerned when these individuals are symptomatic, walking in front of their stores or in their neighborhoods or even in front of community settings, and oftentimes results of calling law enforcement to aid in that. And so I think that, again, this committee really will have an opportunity to look at what does that full continuum for Norman need to look like as it is supported by this new crisis opportunity that we have. But what are the other pieces that makes Norman strong? What are the other pieces that aids these individuals in our community? And I think that's the way. I love this guy here because when he talked about the things that the city had the availability to do as a community mental health center. I can't say city stuff these, can you take my things? I can't do that. And so when you start thinking about, again, ideas.
Yeah.
Thinking about, well, we have the resource, we have utility bills. Well, everybody in the city has a utility bill. What can we create for that outreach, for that information around that? How do we begin to address the stigma of individuals that are mentally ill? Because again, that is a thing. Just because an individual is symptomatic doesn't necessarily mean they need to be set aside in a facility somewhere. And so I think that we look at this public approach. In my head the other day, I envision us working together at a park setting on a Monday night where we have some type of setting in the park for individuals to create awareness, individuals to create opportunities for the mentally ill. I also, again, he mentioned the engagement and outreach team. That is so exciting because instead of law enforcement being that outreach and having to go take an individual from a store that's symptomatic, why come there couldn't be another team that actually goes to talk to those individuals that have experience and expertise around mental illness, to talk to them and engage them and try to get them in treatment? And so I just think those types of things are going to be specific to Norman and how we help Norman move from this crisis state that they see to a state where, again, as a community, we support and provide for our individuals that are in need.
Yeah, and that's the part I'm so encouraged by because it seems like we have a really big piece of the puzzle that we've been challenged with, thinking that, we have to do this all by ourselves.
Absolutely.
When that's not the case. And I already have reasonable understanding of how our continuum of care partners are already working, and they're already able to make those distinctions between how to meet a need that may or may not be a mental or behavioral health crisis versus a whole other cascade of needs that are being met. So it sounds like, or at least I think this is what I'm hearing, that as we roll out and create this 988 number, that those at that call center level, they're also going to have the ability of discerning how I'm really interested in what the handoff is if the decision is made, this is not a mental or behavioral health crisis, but this person still needs assistance.
Right.
And make sure that we understand how that's going to work, and if there's missing pieces, that as a municipality we're able to address that.
Yeah. I know I'm a talker, and that's only because I believe in this
You've
work,
come to the
and
right
I love
place.
And I can say from my standpoint as the interim director of Central Oklahoma, my goal is to make Central Oklahoma stronger for the community, so that we will be able to aid in the handing off of those individuals to quickly get them into treatment and the services and supports that they need. And I'm not just saying that. Again, I think that from the perspective of a individual that is a peer, brother, family members who've had illness, understanding that when families are in need, it's like, you know, if I'm, as a parent, if you had a child that was in need, you go immediately to the emergency room. And you get the help that you need. Again, our facilities should be the same for individuals with mental illness, to the point where, irregardless, if we send a team out, whether it's a mobile team, because we aim to be a mobile team, whether it's our outreach team, whether for whatever reason, safety, our police departments, that we will be the facility. I think that we're better equipped. We have psychiatrists, we have nurses, we have mental health experts such as therapists, our assessors and case managers on staff, and APRNs. And so again, as we build ourselves up to meet you guys where you are, that is my plan. That is the plan that I have.
You know, I can speak for some of the folks from the community that end up at Cleveland County Detention Center, and then really because of unstable mental illness and crimes associated with that. That's a soft spot for me, because as the long-term director of missions at Griffin, I routinely saw people come from Cleveland County Detention Center very, very ill, very, very sick. And the crimes that they committed, were only because that they were sick. So really this mobile team and the outreach teams are going to be that first intervention. They understand trauma-informed care, not only with the family, the consumer, but the families, and what it really is going to take to engage a person. Again, I'll speak of Griffin, but we handle things very differently, because we understand that what's speaking right now in the behavior is pain and suffering, and long-term pain and suffering. And that it's not necessarily somebody committing this crime, or it's not somebody that's, trying to divert law enforcement or any of that. So we tolerate a little bit different too. And so, that's going to help the community. I think that'll actually drive satisfaction in the community, and have people that are kind of knocking on your door saying help. They're going to be saying thank you. It's going to be not only a continuum of crisis care, but a continuum of care in Norman. And I really think that this county is really what networked tight, and they work together well, and that these services in Norman are just going to enhance things that are already working really well in the mental health community. So I definitely want to keep you guys to keep that in mind, because there's a lot going really well in the mental health community, even though people are still dissatisfied. This stuff that we're putting in place, that we want to put in place across the state, hoping going to enhance every community, right? And so
But when of course, there's going to be some people that it's going to be tough. We have some people that are extremely ill. But the one thing about it, with his plan, everybody in the city of Norman would know exactly how to get those people help when that time comes. And that's what I love about that thinking outside of the box concept, where it's not just about the individuals who have illness, it's a community approach to making sure that when we can engage and they stay maintained at the homeless encampment or wherever, but the community knows where, who to call, what to do when in fact that time arrives.
Not just for the community member, but for our families. Like, everyone has mental illness, that runs. And so you guys at this table, or someone or someone, you might be referring people to these services. And so, it's for everybody. It's for everybody.
So it sounded like there's going to be two teams, if I heard that correctly, like a crisis team and an outreach team.
Well, we're at this meeting, we had the meeting
Thursday.
that facilitated. Ideas were coming up, and some of those ideas were, oh my God, really pretty amazing. So this specific work is all about crisis continuum.
So the city could handle the outreach part. Other questions, Councilman Holman?
Yeah, that was kind of part of my question, was what the city's around the state, not just Norman, or what might be expected out of local communities as far as contributing to this program. I think I have some concern about it not being more localized and it being a state or federally run situation that's contracted out to a third party. And so I think a lot of the decisions the council in the past has made were because we felt that there needed to be a better local response, or that there were gaps that we felt the local government needed to fill in where we felt that the state and federal was not. And we felt that our police department is having to respond to all these things. We'd like to reduce some of the call load on them. And so my question being along those same lines, really about what are the cities, Norman, but also all the cities, what is expected of us by the state government, financial contribution, promoting the new law and the change, those types of things. And so still trying to accomplish the goals that we have locally and making sure that, if this is a state-run program, that we're not still going to be having the same local problems that we've been trying to deal with.
I would say in partnership in ways that Nisha identified earlier. I think Norman is in a unique situation. I don't know of any other city out of the state of Oklahoma, other than possibly Tulsa and Oklahoma County, that has came up. I don't even know if Tulsa and Oklahoma County have ever did it yet. Well, Norman is the first city that I'm aware of that actually came up for funding to support a mobile crisis. And so I think that is unique. In that uniqueness, I think that there are things that take place specifically in Norman that are not what you would consider mental health crisis. But when you specifically think about mental health crisis, there is a full continuum, because it's not just about a crisis team being deployed to go get the individual mobilely, but then what? Where does treatment start? Where does treatment happen? What are the different partners in the community that are going to be responsible for those things? And then also, I think the mechanisms that you think about that the state plays a part of in the funding, long-term sustainability, are pieces that are going to be critical to this. Psychiatric medications for those individuals, and what does that look like? And I know that, again, because of state and federal initiatives, those things are in line in the concept and the thought of this crisis continuum. I think this is Shamika's opinion, I think really working with the experts in the community to really think about what is that county's role around this crisis continuum. And it may not be the mobile expedite of a clinical team, and then you want to provide treatment, and then what does that treatment look like, and then what happens with there's a lot to it in a sense. And so I just think that is strategizing around some of those areas, looking at some of the data. Majority of the calls, from my understanding, are not necessarily calls where people are in crisis, but it's calls where people are concerned about individuals that may be symptomatic. And so what does that really look like in need? Are we talking about a true mental health crisis team, or are we talking about partnerships that really aid individuals that need to be actively engaged in treatment that could actually be deployed without taking up the time of the law enforcement?
Definitely appreciate that detailed response. I do have just some concern about it being a state deal and making sure that whatever we do going forward, I don't just want to be like, okay, well, now the state, because I wasn't expecting the state to be doing this actually, so I'm kind of a little surprised, I would say, and so.
Well, and I'm sure you guys were
but excited about it. Yes. Excited and surprised.
But excited at the idea of creating
Absolutely.
something for your guys' self. I bet that was in there too.
Absolutely.
And so this could potentially derail some of even that vision you guys had, right? And so I get that.
No,
I completely
I
understand
think it's
that.
a great thing, actually. Just unexpected, and want us to evaluate how we move forward.
And you should.
With
You
what
should.
we've been thinking so far.
100%.
Yeah,
That would be my request as well. We obviously care enough to budget for this, and I'm thrilled that there's a piece we can, weave into as the pieces come together. And so we've got money allocated for this year though. And so I would request that you meet with us as this solidifies to find where we can identify and address the gaps that are obviously specific to our community. Because I don't want to duplicate services. I mean, all resources are limited. So I want to make sure we're being very judicious with our taxpayer dollars and actually solving the problems. So I hope you can commit to working closely with us, since we are the one city that is prepared to fund solutions. Can I count on you for that?
Absolutely.
Absolutely. We want nothing more
absolutely.
than for mental
No,
health
we
care across the state to be, top notch. And, this is a great opportunity to do that, not only, with Norman, but with the state initiatives. So we want to make the most out of all of them. We absolutely will meet as often as you guys want to meet.
Well, we can hopefully set up a model for the rest of the state.
Absolutely.
Councilman Peacock.
Yeah, along those same lines, will we have the opportunity to kind of have an influence on the RFP selection, or will that be all done by DMH? Or how will the RFP process actually work?
So this piece of it that's up right now, the mobile crisis team, the RFP is being completed right now. It has not been set out for submissions, and so we are still creating that and working on that, and so that will be a DMH process.
Okay.
I would definitely welcome all of your guys' inputs into that, but just like your 1.1 million, right? We'll have input into what you spend, you'll have into what we spend.
Sure,
but again, teamwork, right? Yes. We need to work together and make things happen. But definitely, let's talk.
So on the community end, I think that we are DMH. Central Oklahoma is a DMH facility. But then often, just because we are a DMH facility, we have to be competitive as well. Mm-hmm. And we have to apply for things like RFPs. If in fact that is the case, then yes, I think that the community of Norman and individuals should be part of the development of what we are going to propose. And so I think from the standpoint of, wanting and desiring to become a mobile crisis team that is physically in Norman, I would say if I have to write for it, if we have to write for it, yes, we would want the community's input, absolutely.
We want it to work.
And would you anticipate that selection process would be blind, so that proposals would be judged based on their merits, not on their relationships, basically?
Oh yeah.
Okay. I mean, I know we talk about competitive RFPs. I know how that system works sometimes, and it's usually what you know, not who you know. So
yes.
I just want to be sure that it's going to be a fair shot for all entities.
Again, we have one opportunity to spend this money.
Sure.
We need to do it right. It needs to happen in a way that is successful. So
absolutely.
we're gonna go forward.
I really appreciate you saying that.
Councilman Schuler.
Just along that same line of questioning, just in terms of like input with the RFP process, what does that look like for us? Like how would we give input from like citizens or from us, or like how do we enter into that input process?
Currently we're creating that, right? And so is there a piece that you guys want, that we could consider for the team, not just for Norman, but like in the contract itself, right. Is there something specific that you guys have on your mind, on your dream, in your fantasy of how your team was going to go, that you recommend that we include in ours, and we would like to hear that feedback from you guys. What do you see missing in Norman?
Absolutely.
Maybe it's missing in all communities, and we're not seeing it even. And so we would like to know.
Is there like a direct person, I guess, is what I'm kind of asking. Like, is there a point of contact who's creating that? Where does that information need to go?
Yes, Nisha and myself are on the team, the committee that's putting that together. It's 5 people, and so either one of us, both of us, we can give you guys our email before we leave.
Yes, please.
I think it would be also helpful to work with the Oklahoma Municipal League, because while Norman may have done it first, I'm confident we're not the only elected officials in this state who are interested in making sure that this looks like something that will solve our issues. So are there plans for that, working with cities on a bigger level to get feedback and input?
We talked to Municipal League, if you haven't already gone through anything with them, but they're definitely, whenever we go through these processes, and we've done it, it's one of the groups that we usually are working with these types of things. So we're in regular communication with all these different groups.
They do a good job of communicating with cities around the state. Councilman Berlin.
Quick questions, hopefully quick answers. during this line of, or during this process from the national level, has anybody that's been on these mobile teams been injured or killed in the service of this?
I can't answer that.
Okay.
I'm going to say that when you talk about crisis mental health work, it is dangerous work. You know, it is. It's a population that, in the criteria for evaluation, meeting criteria for crisis level or inpatient care, that, you know, it's either dangerousness to self or others, or unstable mental illness or substance abuse. And substance abuse can drive its own, you know, behaviors and type of mental illness that's really scary until stable. But the dangerousness to self or others can be very, you know, scary too. And within all of our organizations, you know, we call law enforcement. All the, like Shamika, if there was a fight or if there was something, the mental health center would engage law enforcement to help out with that. You know, at Griffin, we have interventions that we do. We, you know, de-escalate. We have physical interventions. Do people get hurt? Yes. Are there, you know, on the job injuries? There are. You know, like it's part of the business, unfortunately.
And I think that, again, to answer that question directly, I'm not aware of anything, but and so I can't say if anybody's ever been hurt, whether it was the staff or the individual. But I can say it's the models of training that we go through and that we receive are, you know, again, evidence-based practices that show productive outcomes. So when it's kind of like the CIT training your law enforcement people. These are individuals that have been trained in crisis intervention training to do that interaction with an individual that's in crisis. Again, that types of training prepares them for those events. And so I don't know.
But I can also tell you that, like, what we're talking about in terms of this mobile crisis team and is really more of like a willing, you know, like they're willing to go. We're not going to have mobile teams like physically restraining folks and forcing them in the vehicle and, you know, having handcuffs. That's not going to happen. Like, they're going to be very comfortable at dispatching law enforcement, engaging law enforcement, because again, we're partnering together and we want the best for the person. There's going to be a point sometimes that it's beyond mental health providers' capability to help, to assist. I can currently think of multiple ongoing situations where law enforcement engaged and handled situations in a way that was just miraculous here in Norman, and brought people to us. And I don't know how many times I've looked at Lieutenant Bryant and said, how did this go well? You know, and it gives me chills to think about it, because again, we're a team, you know, and there's going to be a point that these mobile teams are going to have to ask for help. And that's when we'll engage help.
Last question. You can FOIA request a 911 call. Are you going to be able to FOIA request a 988 call, or is that going to be shielded?
Forward? You said forward?
FOIA. Freedom of Information Act request.
I mean, there's.
Is that HIPAA protected?
You know, that's a good question. I'm going to say
No,
it
it
has.
should be.
I'm going to say it has to be, because it's mental health, and mental health is protected. Even the contact with law enforcement, even though that they don't have HIPAA, they still are. That is still protected, and so I'm going to say that it is protected from what I understand at this point.
Okay, thank you.
All right. Any other questions? Any other slides?
I mean, there are more slides. This is the transportation one that we.
Well, for what it's worth, as the slides come up, you've covered what's on them. So
I think that happened. Thank you. Thank you. I'll go through them just for the, you know, sake of it. Oh, this is a great last slide. This is fantastic. Yes. I don't know. I don't know how we forgot this. So the state is also purchasing iPads for every single law enforcement in the state to have. So we will be distributing these, which will then connect with mobile crisis teams and call center folks, and as needed, whoever that might be. So that is a fantastic thing right there in the community on the spot.
So we just received our first part of that, where I've identified the law enforcement agencies within Cleveland County, where we are planning to have a formal meeting and conversations about how many actual iPads that they will need. And in addition to that, I think that it will be a great opportunity for me to meet those captains and professionals in order to really talk about how we can be a better service to them. And so, yes, how did you forget that?
I don't know. I didn't go to it. I just didn't go to it. Hey, and one more thing. As you guys probably already know, Norman PD has committed to every single officer being CIT trained. So that is, again,
That's
unique
amazing.
in Norman.
That is amazing.
And
That was my question when I saw that, because I know we have that goal and that commitment. Will this help pay for that?
so we already have a team partnership with them to do this, and so we're just going to continue with that training. It's a week-long training. Part of the training is also coming into the facilities or meeting with facility directors and point folks to. It's been Zoom the last few months because of our situation, but by history they would even come to our facilities and tour our facilities and go on our units and have a real-time, real-life understanding of what it's like in the mental health inpatient crisis care. So that will continue at some point, but for now it'll be on Zoom. But we have this great thing going right now.
Madam Mayor, just a question, and I don't know if you know, but in our conversations with Mr. Splitt and Norman Regional Healthcare on the Porter campus, they have a piece of real estate that they're in negotiations with for another behavioral health care inpatient provider. I don't know if you know that yet.
You know it.
I figured you'd, okay, just
He
wanted to
knows
make
a
sure.
lot. I didn't know
It's
that.
a great additional resource coming in Norman, so as long as you know, we're good.
That's fantastic. There might be another slide.
There you go.
Even another one. Hey, thank you guys. We really appreciate your time.
I look forward to working with you.
Yes, absolutely.
Very
Thank
good,
you.
very good.
All right,
Thank you.
6:30 to 13 minutes, y'all.
That was great. Really wish we could have had that before the budget.
I guess we should.
Good evening, and welcome to the City Council, Norman Utilities Authority, Norman Municipal Authority, and Norman Tax Increment Finance Authority meeting of July 13th, 2021. Madam Clerk, will you please call the roll?
Councilmember Studley. Here. Councilmember Schuler.
Here.
Councilmember Lynn.
Here.
Councilmember Hall.
Here.
Councilmember Tortorello.
Here.
Councilmember Foreman. Councilmember Holman.
Here.
Councilmember Peacock.
Here.
Mayor Clark.
Here. Please join me in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I would now like to recognize Judge Drew Nichols to administer the oath of office to Councilmember-elect Studley.
Raise your right hand. I state your name.
I, Brittany Studley,
Do solemnly swear
do solemnly swear
that I will support, obey, and defend
that I will support, obey, and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of Oklahoma,
and the Constitution of the State of Oklahoma,
and that I will not knowingly receive,
and that I will not knowingly receive,
directly or indirectly,
directly or indirectly,
any money or other valuable thing
any money or other valuable thing
for the performance or non-performance
for the performance or non-performance
of any act or duty pertaining to my office,
of any act or duty pertaining to my office,
other than the compensation allowed by law.
other than the compensation allowed by law.
I further swear
I further swear
that I will faithfully discharge my duties
that I will faithfully discharge my duties
as council member to the best of my ability.
as council member to the best of my ability.
Ramsey Studley for Ward 1, I declare you duly sworn and seated to the office of council member for the city of Norman.
Thank you.
And for those of you wondering why we had to swear in Councilmember Studley, our last swearing in was for the completion of the remainder of Councilmember Bierman's term, and this is officially for the beginning of her term. Congratulations. We're on to item 2, approval of the City Council study session minutes of October 6th, 2020, City Council special session minutes of October 20th, 2020, City Council, Norman Utilities Authority, Norman Municipal Authority, and Norman Tax Increment Finance Authority minutes of June 22nd, 2021. I need a motion to approve the minutes.
So moved.
Second.
Thank you. The motion on the floor is to approve the minutes. Madam, council members, you may cast your votes.
All votes have to approve the minutes passes unanimously.
Thank you. Item 3 is resolution of the Council of the City of Norman in conjunction with the Norman Animal Welfare Oversight Committee awarding the 2021 City of Norman Animal Welfare Volunteerism Award. I need a motion to adopt or reject the resolution.
Adopt.
Second.
Thank you. The motion on the floor is to adopt the resolution. Council members, you may cast your votes.
All votes have been cast, and the motion to approve the resolution passes unanimously.
Thank you. A resolution of the Council of the City of Norman, Oklahoma, in conjunction with the Norman Animal Welfare Oversight Committee awarding the 2020 Norman Animal Welfare Volunteerism Award. Whereas the Norman Animal Welfare Oversight Committee seeks to promote pet adoption, education, citizen involvement, and volunteer services for the Norman Animal Shelter and ensure all animals adopted at the Norman Animal Shelter are spayed and neutered. And whereas that programs instituted for the care of animals involve citizens and coordination with other outside agencies in an effort to maximize adoption of the animals at the Norman Animal Shelter. And whereas the Norman Animal Shelter includes in its mission the involvement of citizens as partners to the caring of the animals when they are in the city facility. And whereas the City of Norman entrusts the Norman Animal Welfare Oversight Committee with the duties of providing advice to the city on issues involving the care of animals and citizen involvement. And whereas on May 23, 2016, the Norman Animal Welfare Oversight Committee unanimously approved to establish the Norman Animal Welfare Volunteerism Award and named Erica Loftus as the inaugural recipient. Now therefore be it resolved by the Council of the City of Norman, Oklahoma, that the City of Norman, Oklahoma, in conjunction with the Norman Animal Welfare Oversight Committee, does hereby award the 2020 Norman Animal Welfare Volunteer Award to Dr. Jennifer Devine and Jessica Beam. I'd now like to recognize Kim Fairbanks and Martin Lowry. Come on up. I'd like to recognize Kim Fairbanks and Martin from the Animal Welfare Oversight Committee to present the resolution and to say a few words.
Thank you, Mayor and council members. I just appreciate your time and giving us this opportunity to present this award. This is, I guess, our fifth round of volunteers. I'm Mark Howery, a co-chair of the Animal Welfare Oversight Committee. Kim Fairbanks is with me. She's one of the members and actually a past recipient of this award. And we'd like to present this award to this year's recipients.
It is an honor as a member of the Animal Welfare Oversight Committee to present the 2020 Norman Animal Welfare Volunteerism Award. The award was created in honor of Erica Loftus, who is a Norman resident that dedicated her life to saving animals. The award celebrates individuals who have made substantial contributions to our community in the animal welfare field. Tonight, we are recognizing two individuals that are co-recipients. As a past recipient of this award, this is especially meaningful to me to present this, as I know both individuals, and I have witnessed their dedication firsthand over the years. Jessica Beam has been in the veterinary field for 18 years and is a registered veterinary technician. In 2017, she began volunteering at Norman Animal Welfare, assisting the veterinary clinic with tasks such as giving vaccines, microchipping, and preparing animals for the spay-neuter clinics and providing aftercare. She has also fostered dogs and cats for the shelter that needed extra attention due to medical concerns. Jessica also volunteers with the St. Francis Animal Resource Center, which is a local nonprofit, and is transforming the lives of pets by honoring the love people have for them. She has done this by way of closing the service gap of affordable vet care and accessibility that exists for people and pets in the underserved areas in our community. Excuse me. Some examples of her work include organizing a pet food pantry, assisting with low-cost spay and neuter outreach clinics, and early intervention programs like the microchip and vaccine outreaches, all which help keep the pets out of our shelter system and with their families. By bridging this gap in our community between animal services, people and their pets are kept in their homes, and we appreciate the dedication to improving the lives of those pets, and Jessica is very deserving of this award. Congratulations, Jessica. Our next recipient is Dr. Jennifer Devine. She has eagerly served the Norman community in a volunteer capacity since 2019 by providing greater awareness of animal welfare through the outreach events with Hands Helping Paws and their partnerships with Norman Animal Welfare. Dr. Devine's efforts to serve our community during the COVID-19 pandemic is commendable. When many services were shut down or severely restricted, she worked with HHP to overcome challenges so that the health of our community's pets were not overlooked or delayed. Dr. Devine provided services to approximately 800 animals during the pandemic through many low-cost spay and neuter clinics and vaccine and microchip outreaches. She is also directly responsible for lowering the number of community cats reproducing in our community by providing the free trap, neuter, return spay neuter clinics, along with HHP helping coordinate that. This is very important because it prevented the cats and kittens from entering the shelter system, and that directly benefits the shelter's space capacity and live release rates. Dr. Devine is passionate about improving the quality of pets' health in our community, and we look forward to her continued volunteer efforts. It is our pleasure to present this award to Dr. Devine. Thank you.
Congratulations again. Item 4 is Proclamation 2122-14, a proclamation of the Mayor of the City of Norman, Oklahoma, proclaiming the month of July 2021 as Water's Worth It Month in the City of Norman. I need a motion to acknowledge receipt of the proclamation.
Second.
Thank you. The motion on the floor is to acknowledge receipt of the proclamation. Council members, you may cast your votes.
All votes have been cast, and the proclamation acknowledgement passes unanimously.
Thank you. A proclamation of the Mayor of the City of Norman, Oklahoma, proclaiming the month of July 2021 as Water's Worth It Month in the City of Norman. Whereas Water's Worth It Month is being promoted by the Environmental Control Advisory Board to help increase community awareness of Norman's most precious natural resource. And whereas Water's Worth It is a campaign by the Water Environment Federation to help answer questions about how our actions, attitudes, and the things we most value are closely connected with water. And whereas Water's Worth It Month is one of the many ways to help promote the protection of Norman's water by increasing educational efforts, by including booths at various functions and locations, information in newspapers, and literature showing citizens how to conserve and protect water. And whereas water's worth our respect, communities are built on water. And whereas water's worth our effort, clean water is everyone's responsibility. And whereas water's worth our health, water is life. And whereas water's worth our future, dealing with an aging infrastructure. And whereas water's worth our passion as we find solutions for the 21st century. And whereas the protection and conservation of Norman's water improves the quality of life by having a cleaner and more abundant supply of water now and in the future, and reduces the cost of water and wastewater treatment. Now, therefore, I, Mayor of the City of Norman, Oklahoma, do hereby proclaim the month of July 2021 as Water's Worth It Month and call upon all citizens and civic organizations to become knowledgeable and acquaint themselves with the problems involved in maintaining safe water. I'd now like to recognize Dane Hines, our Environmental Control Advisory Board member, to accept the proclamation and say a few words.
Thank you, Mayor Clark and members of the council. I'm Dane with the Environmental Control Advisory Board of Norman. We're thrilled to be here to accept this proclamation officially designating July as Water's Worth It Month this year in Norman. This month, we take extra time to appreciate our water and think about how we can support each other in sustainably managing our water resources. I want to shout out the Norman Stormwater Division and environmental services who do an amazing job of protecting water quality and helping get out the Water's Worth It message here in Norman. I also want to say thank you to the city's water treatment, water reclamation, and line maintenance divisions who work around the clock to provide reliable services to our residents. And finally, I just want to provide a couple resources for those of you who would like to learn more about what you can do to help keep Norman's water clean and plentiful. You can visit greennorman.org. You can visit ltwaok.org. And you can also visit the city's website, navigate to the Stormwater Division section under Public Works. There's a lot of good information there. Thank you.
Well, come get this proclamation. Congratulations. Thank you for your work.
Thank you so much.
And definitely a big shout out to all of our hardworking, amazing staff, and thank you to all of the volunteers that were recognized tonight. Now we're on to council announcements. Please remember to limit your comments to announcements only, and we'll start with Councilmember Studley in Ward 1.
Excuse me, I don't have any announcements for my ward per se, but I just want to announce that if you have not read the press release by the Norman Parks and Recs about the mosquito stuff, please look. I know they're attacking us right now, so we are doing something about it. We're in the process, and we hear you. We're all suffering too, so stay in as you can between dusk and dawn. Something like that. So, dawn to dusk. Just stay inside if you can. That's it.
Thank you, Councilmember. Councilmember Schuler.
Yeah, so I want to let Ward 2 know that tomorrow, Wednesday, July 14th, we'll be having a ward meeting ahead of the retreat this weekend. That is going to be at St. Stephen's United Methodist Church, which is at 1801 West Brooks at 6:30 p.m. And masks will be required, just to let everybody know. So we'll have some available if you forget them. So tomorrow night, ward meeting for Ward 2, 6:30 at St. Stephen's.
Thank you. Ward 3, Councilmember Lynn.
Tall grass, they're working on it. That's it.
Progress. All right. Ward 4, Councilmember Hall.
First of all, I would like to thank all of the Ward 4 residents who came out this Saturday morning at the Norman Public Library Central for Ward 4 meeting. We had a lively conversation about the council retreat coming up this week and areas of concern and interest that they passed along to me. So I always appreciate having input from our Ward 4 neighbors. As always, any of you who were not able to come to the meeting can always contact me by phone or by email with any input you would like to share before the retreat this weekend. The other thing I'd like to announce, which I've actually announced several times previously prematurely because these meetings did not happen for lots of good reasons, but the Historic District Commissioners have been working diligently along with city staff for the last 2 years to revise the Historic District Guidelines. This happens about every 10 years. The last time they were revised were in 2009. As many of you know, we have 3 historic districts in Norman. They're all located in Ward 4. The Chautauqua Historic District, the Miller Historic District, and the South Historic District. So we have finally reached the place where there is a draft that's available to the public for their review, and there are going to be 2 public meetings. They really are going to happen this time, right? And the first one is next Monday, July 19th at 5:30. Right here in the City Council chambers. The second meeting is also on a Monday, July 26th at 5:30, also in the City Council chambers. And for any of those of you who are interested in reviewing the guidelines, you can go to the city website to the Your Government tab, choose department, the departments of planning and community development, and then under that tab is the Historic District Commission, and you can see the draft copy of the guidelines. If you have any questions about that, I can refer you to commissioners, or you can always reach out to me, and I'd be glad to walk you through that. This is an important step for the next 10 years, so I really encourage anyone who has an interest in historic preservation and preserving our neighborhoods to take advantage of this public hearing.
Thank you, Councilmember. Ward 5, Councilmember Tortorello.
There's a poll still on Facebook for the questions and priorities you want us to discuss Friday and Saturday for the retreats. It's still open, so go to it, and I'll be looking at it every day until Thursday. We'll probably close it Friday morning, but ask your questions. It's ranked and stacked according to what you guys are looking for, and I look forward to hearing what you have to say about Ward 5.
Thank you. Ward 7, Councilmember Holman.
Thank you. I also want to encourage Ward 7 residents to reach out this week. I've been hearing quite a few of concerns that are going on in Ward 7 specifically, and of course citywide. But feel free to reach out at my ward7@normanok.gov. You can use my phone number, send me a text or a call, whatever may be the best way of communication for you. And I will definitely make sure that we discuss those issues at the retreat this weekend. So I want to remind everybody also our next Community Planning and Transportation Committee meeting will be on August 19th. We don't have any this month, but we'll be back next month. And in this specific committee, we discuss the monthly transit ridership reports, and we get updates about a lot of road construction, other types of projects like that going on throughout the city. So that's always a good opportunity to get questions or comments in about those types of things. If you have questions or concerns about road projects or public transit or anything like that, sidewalks, let us know, and we can make sure that those issues and topics are discussed with our city staff in those committees, and we can get get answers, and sometimes we can get policy change too. So definitely encourage everybody to tune into that or attend in person if you like. And then I also wanted to encourage everybody to watch on YouTube the council conference that we just had that started at 5. A very important topic that we've been discussing in Norman for quite some time in regard to mobile crisis response. Some new information from the state and federal government that we've been made aware of, and a lot of very interesting stuff, so I encourage everybody to take a look at the meeting we just had on YouTube. And then also I would agree, in my opinion, I'm glad to see Water's Worth It is this month, because that is the most precious resource on the planet, in my opinion. So, and then with mosquitoes, I absolutely agree. Take a look at the press release. I posted it on my personal page, my council page, the ward page, and a couple of the Ward 7 neighborhood pages. I've heard a lot of feedback from Ward 7 residents, especially ones that live around Eagle Cliff in the south of Highway 9 area that's closer to the river. A lot of issues with mosquitoes, as you can imagine. So the city is trying to address that issue in a way that is a little maybe different than the way we've always done it, that might be a little more environmentally friendly as well. So thank you. That's all I got.
Thank you. Ward 8, Councilmember Peacock.
Thank you. Yeah, I was also going to mention the study session, so thank you, Councilmember Holmes, for bringing that up. It was a very insightful and informative conversation. I really encourage everybody to go look at it. I think it addresses a lot of concerns and questions about what we're talking about. Also, much like my other colleagues, I'm seeking input from Ward 8 on issues and priorities to discuss this week at our retreat. So my Ward email is the same. It's just ward8@normanok.gov. There's a poll on the Ward 8 Facebook page, and also my cell phone number is public record. So please reach out to me in any of those ways, and I'm happy to take any of your concerns and questions.
Thank you. I have a few announcements myself. Thursday the 15th at 9 a.m., we'll have the groundbreaking for the expansion of our Healthplex, which I encourage you to attend if you are able. We have another groundbreaking next Wednesday, the 21st at 10 a.m. for the Young Family Athletics Center. Many exciting things happening in our community as we look to the future. This Saturday is National Ice Cream Day once again. If you want to see us all make fools of ourselves trying to eat a banana split as fast as we can, your opportunity has arrived. So that will be Saturday with Rusty's Custard Sunday. It's Sunday? Wow. Glad you guys corrected that. I'll be passing on that one. Okay, Sunday's on Sunday. I get it. All right, that makes perfect sense. So, thank you, colleagues. Sunday at 2 p.m., banana split eating contest, and another fun, safe event in our community. I hope you will get out and shop local and eat local, for that matter. The following weekend, Saturday, July 24th at 9 a.m., I have another Move with the Mayor event. We will actually be walking around the beautiful University of Oklahoma campus with our own tour guide. So if you haven't had an official tour of the University of Oklahoma, here's your chance. And then on Sunday, July 25th at 5 p.m., it's the return of the Mayor's Book Club. We will be meeting at the Redbud Room of Norman Public Central. We're reading Fire in Beulah, and Rilla Askew is a local author, and she will be joining us to answer questions and discuss the book as well. So I hope you will consider joining me for those events. Last announcement, we have plenty of openings on boards and commissions. I encourage you to see what those are, get involved. I think our citizen and resident engagement is one of the most important and impactful things in the city of Norman, and you can find that list on the City of Norman website, normanok.gov. With that, we will move on to the consent docket. This item is placed on the agenda so that the City Council can designate those routine agenda items that they wish to be acknowledged by one motion. I need a motion to place items 5 through 52, excluding items 7 and 42 on the consent docket.
So moved.
Second.
Thank you. The motion on the floor is to place items 5 through 52, excluding items 7 and 42 on the consent docket. Council members, you may cast your votes.
All votes have been passes unanimously.
Thank you. Item 5, first reading of ordinance 2021-47, rezoning property located on the west side of 48th Avenue Northwest, approximately 1,600 feet south of Franklin Road, from A2 Rural Agricultural District to PUD, Planned Unit Development District. Item 6, first reading ordinance 2021-46, rezoning property located a quarter mile east of North Porter Avenue on the north side of Tecumseh Road, from A2 Rural Agricultural District to PUD, Planned Unit Development District. Item 7 has been removed from consent. Item 8, submission of the city manager's contract and change order report. Item 9, award of a request for proposal from Arthur J. Gallagher for insurance broker services. Item 10, bid for the purchase of liquid ammonium sulfate for the water treatment facility. Item 11, bid for the purchase of fluorosilicic acid for the water treatment facility. Item 12, bid for the purchase of liquid oxygen for the water treatment facility. Item 13, bid for the purchase of sodium hypochlorite for the water treatment facility. Item 14, bid for the purchase of sodium hypochlorite, this one for the tanker for the water treatment facility. Item 15, bid for the purchase of ferric sulfate for the water treatment facility. Item 16, bid for the purchase of hydrogen peroxide for the water treatment facility. Item 17, approval of payment of FYE 22 dues assessment in the amount of $65,000 to Oklahoma Municipal League for the period of July 1, 2021 through June 30th, 22. Item 18, approval of payment of FYE 22 dues assessment in the amount of $68,856 to the Association of Central Oklahoma Governments for the period of July 1, 21 through June 30th, 22. Item 19, granting easement 2122-1 to OG&E to provide electrical service to a new charging station at 2531 Goddard Avenue. Item 20, granting easement 2122-2 to Western Farmers Electric Cooperative for the purpose of accommodating utility relocation for the 36th Avenue Northwest widening project from Tecumseh Road to Indian Hills Road. Item 21, consideration of the final plat for Cedar Lane Addition, Section 3, located on the south side of Cedar Lane Road, west of the railroad tracks. Item 22, final plat for Win-Win Addition, located at 3724 Classen Boulevard. Item 23, rural certificate of survey for Beauchamp Meadows and acceptance of the subsequent easements, generally located on the east side of North Porter Avenue, approximately half-mile north of Franklin Road. Item 24, certificate of plat correction for Carrington Place Addition, Section 12, Lot 4, Block 4. Item 25, certificate of plat correction for Carrington Place Addition, Section 14. Item 26, approval of expenditure number 6 to contract 1314-102 with Smith Roberts Land Services in an amount not to exceed $89,055 to provide right-of-way acquisition services under an on-call contract for the Porter Avenue Streetscape 2019 bond project. Item 27, amendment number 5 to contract 1516-110 with ADG PC in the amount of $481,500 to provide professional program management services for certain ongoing construction projects. Item 28, change order number 4 to contract 1920-13 with EMC Services, increasing the contract amount by $3,337.74 for the FYE 2020 sidewalk concrete projects and final acceptance and payment of the project. Item 29, final acceptance and final payment of the contract with G&L Tank Sandblasting and Coatings, LLC, for the Cascade Tower resurfacing project. Item 30, bid contract and bonds with NAS Construction Company in the amount of $313,109 for the sidewalk concrete projects and redistribution of the project funds across sub-projects. Item 31, bid contract change order and bonds with EMC Services, LLC, in the amount of $832,595 and change order in the amount of $24,200 for a total amount of $856,795 for the Street Maintenance Urban Concrete Program Bid 1 FYE 22 locations. Item 32, bid contract and bonds with A-Tech Paving in the amount of $744,226.25 for the Street Maintenance Urban Concrete Program Bid 2 FY22 locations. Item 33, bid contract and bonds with Silver Star Construction in the amount of $1,128,500 for the Street Maintenance Asphalt Pavement Program FYE 22 locations. Item 34, bid contract and bonds with Haskell Limited Construction in the amount of $370,370 for the Bridge Maintenance Program, FYE 22 locations. Item 35, bid contract and bonds with ASTI Sawing Incorporated in the amount of $34,470 for the sidewalk horizontal saw cut projects. Item 36, a Norman Utilities Authority contract with the Oklahoma Water Resources Board and the U.S. Geological Survey to provide for Canadian River water quality and water quantity monitoring. Item 37, contract for an interlocal agreement with the Cleveland County Commissioners for construction and repair of section line roads with the city limits of Norman from July 1, 2021 through June 30th, 2022. Item 38, contract with ODOT for the traffic signal upgrade project emergency vehicle pre-exemption system. Item 39, contract with Metropolitan Fair Housing in the amount of $30,000 as agreed upon under the 47th Year Community Development Block Grant Program in the FYE 22 Home Investment Partnership Program. Item 40, contract with Habitat for Humanity in the amount of $30,000 for the acquisition of property to be utilized as affordable housing. Item 41, contract with Norman Affordable Housing Corporation in the amount of $100,000 for the acquisition of property to be utilized as affordable housing. Item 42 has been removed from consent. Item 43, bid contract and bonds with D.O. Construction in the amount of $342,502.15 for the Merkle Creek Drainage Improvement Project. Item 44, change order number 2 to contract 2021-35 with Flintco LLC, increasing the contract amount by $75,156.98 for a revised contract amount of $8,787,894.63 and adding 39 additional calendar days for the North Base Complex Project Phase 1. Item 45, a resolution for a workers' compensation settlement for Robert Pack. Item 46, resolution for a workers' compensation settlement for Leon Ragland. Item 47, resolution reallocating $9,560 from various sidewalk accounts prior year balances to aid staff in meeting sidewalk project goals for FYE 22. Item 48, resolution accepting a grant in the amount of $30,000 from the National Fitness Campaign to go towards a fitness court in Francis Cape Park. Items 49 through 51 are related to the rezoning application for Shaz Investments for property generally located half-mile south of Cedar Lane Road on the east side of Jenkins Avenue and extending southeast to 12th Avenue Southeast, and are being postponed to the August 10th, 2021 council meeting. Item 52, a contract between the City of Norman, the Norman Municipal Authority, and the Trey Young Family Foundation for the donation of $4 million for the construction of the Young Family Athletic Center. I need a motion to approve or reject the consent docket.
Motion to approve.
Second.
Thank you. Are there any comments from council regarding any item on the consent docket? Councilmember Hall.
I would just like to draw attention to several items that we just reviewed. We have a lot of items on the consent docket tonight, and number 39, number 40, number 41 all have to deal with an issue that we definitely want to keep in front of us and focus on, and that is affordable housing. So all three of these items are the city's ability to be able to work with our partners within Norman to continue to address the need for affordable housing and the success that we've had with our working partners to move forward again this year to continue to provide affordable housing. So appreciate all the work on part of the city staff and definitely appreciate the work of our partners to continue to address this much needed issue.
Thank you, Councilmember. Councilmember Holman.
Thank you. I was just going to bring up there a couple of the items that were on consent regarding development issues in Ward 7 in the south of Highway 9 Eagle Cliff area. Items number 49, 50, and 51. The representative for the developer could not be here tonight, and I won't be able to be at the next meeting. So we were able to agree to a postponement until August 10th. So that night we will talk about their updated proposal and decide what to do from then. So just encourage everybody that's interested, and I've heard from quite a few residents and Eagle Cliff and the surrounding area about this particular development, that August 10th we'll be discussing that in more detail and making a decision from there. So please reach out to me again with my email or phone to discuss this further if you're interested. Thank you.
Thank you. The motion on the floor is to approve the consent docket. Council members, you may cast your votes.
All votes have been cast, and the motion to approve the consent docket passes unanimously.
Thank you. Item 7, consideration of the mayor's appointments as follows. The Floodplain Permit Committee, Bill Scanlon. The Human Rights Commission, Jackie Farley and Samuel Woodfork. Pioneer Library System, Jonathan Fowler. I need a motion to confirm or reject the mayor's appointments.
Motion to confirm.
Second.
Thank you. Is there any discussion or questions? Councilmember Lynn.
I had grave concerns with one of these appointments, the Human Rights Commission. I don't know how to say it. I'm not trying to embarrass anybody, but going back and looking and do some research on one of these, the Ward 8 member, very divisive, advocated for the death of pastors, was very bigoted towards conservative Christians, towards men, towards the Second Amendment in general. And if that's somebody that's going on our Human Rights Commission, I mean, I could read the post, I'd rather not. They're available publicly on her Facebook. And they were absolutely so far out of line of somebody that should be on a commission like this. If this is Human Rights Commission, you should be concerned about human rights. You should care about evangelical Christians. To have such frothing hate for Christians in general while she's in a church attendee. It's just hard for me to get over. And calling the GOP just racist, sexist, bigoted, I just don't know how somebody fits into this. And another point on this would be, I think OU is a great partner for this city, but there is a stranglehold on our city by the OU that's involved in these committees and represented on this council. And I just don't think we need any more influence from the university. Like I said, they're a great partner. I'd like to take the time and share some of these posts, but I'm not here to embarrass that person. That's why I earlier today asked this item to be moved, and this person may be withdrawn, because it is very, very divisive inside of a committee or a Human Rights Commission that I'd say about 50% of the town doesn't even approve of, even having in our charter. And if we're bringing just this type of political slant to this Human Rights Commission, I just don't see what purpose that is serving.
Thank you. The motion on the floor is to confirm the mayor's appointments. Council members, you may cast your votes.
All votes have been passes by a vote of 6-2. Voting against, Councilmember Lynn, Councilmember Tortorella.
Thank you. Item 42, a contract with Neighborhood Alliance in the amount of $100,000 funded by Community Development Block Grant Funds for the Norman Neighbors activities. I need a motion to approve or reject the contract.
Approve.
Second.
Who is the motion to approve? Councilmember Studley, thank you. I'd like to recognize Lisa Craig for a brief presentation.
Mayor, Council, Lisa Craig, CDBG Grants Manager. I do want to make a clarification. These are not block grant funds. These are general funds it gets confusing, I know. But I would like to take the opportunity to thank the council. We've had several meetings over the last year talking about the programs offered by Neighborhood Alliance. I personally have utilized them as a resource and support for many years for the activities that we do with the block grant program in our target neighborhoods. At this time, I'd like to introduce Georgie Rasco, the Executive Director, and we have a short presentation, maybe, to let y'all watch a video about Neighborhood Alliance, and then we would be happy to answer questions that you guys may have, if I can get this going the way it needs to go here. There it is. All right. There. Okay. Maybe. It worked earlier. You want to just skip it? You want to skip it? Yeah, vice versa. Okay. He's the miracle man. Okay.
Well, while he's working on that, I'll take a moment of privilege and give a big shout out to the Young family for $4 million for a very exciting project that benefits youth sports, quality of life initiatives, and hopefully sports tourism as well. I'm incredibly grateful for it, and I look forward to the groundbreaking again, which is July 21st at 10 a.m. At 10 a.m., and it's the site that it will be located on University North Park, and I hope you will join us. I believe the Young family will be in attendance. Okay.
We believe in our community. We believe in block parties, front yard watermelon feasts, neighborhood Easter egg hunts, and reuniting neighbors with their lost pets. We believe in protecting property values and creating great places to live, work, and play. We believe in knowing our neighborhood police and fire officers by their first names. We believe in front porches, sidewalks, and neighborhood parks. We believe that you do not have to move in order to live in a better neighborhood. We believe that corporations are just waiting to be asked to help neighborhoods and local citizens thrive. We believe that our #1 crime prevention tool is to create a more social neighborhood. We believe in educating ourselves so we can be better, more involved, and more informed citizens. We believe our mayor, city council, and municipal employees all want what we want, a great city filled with great neighborhoods. We believe with support and training, all citizens have the power to be great neighborhood leaders and to lead positive change. We are the Neighborhood Alliance, and since 1977, we've believed in safe, healthy, and attractive neighborhoods for all.
Thank you, Mayor. Thank you, Council. My name is Georgie Rasco, and for the last 20 years, I've been the Executive Director at Neighborhood Alliance of Central Oklahoma. We're located in a wonderful old firehouse on the corner of Northwest 36th and Classen. We're a very unique organization, unique to the point that two of your professors here at OU in the Graduate School of Architecture have gotten a grant to research us so that hopefully they can be published and write an article that will showcase how we do what we do in the city for the last 47 years for other departments and municipalities across the country. You are our first foray into entering into a satellite office, and we're thrilled as could be to do that. We're looking forward to working with the City of Norman and bringing our own staff, of which I had to figure out for a grant the other day that 83% of my program staff have been at my office, have been with us for 7 years or more. So we have a staff that stays, we have a staff that enjoys what they do, and we're going to be hiring a dedicated employee that will work specifically in the City of Norman. Haven't quite found them yet because it's got to be the right person. It's got to be somebody that lives here, that knows this, that really cares deeply about it. We're not telling you anything you don't already know about neighborhoods, I'm sure, but what we're hoping to do is for you as council members and as a city is to bring you tools that you can directly and tangibly give to your residents. Tools that will help them become the kind of leaders that they need to be and they want to be, but no one's really ever sat down and talked to them, maybe since Girl Scouts or when they were in Boy Scouts. But now as adults, we need to learn how to advocate for our own needs and how to work cooperatively with the city, with the municipality, with the police, with the fire. We believe strongly in grassroots organizations. We believe that local people have the solutions to local problems. And if you give them the tools where they can start to understand how systems work, then they can come to you as their representative leader or to the different boards and commissions at your city and work with them to be able to solve the city's issues. They're not going to solve them by themselves by any means, but also more than that, research proves that organized neighborhoods or more social neighborhoods have less crime. The children in those neighborhoods go further in education. Seniors age longer in their homes in those neighborhoods. The social values alone for the people that live there are greater. The property values are greater. I'm sure every one of you at some point have neighborhoods in your wards that you can just drive into and just feel a little bit of relief. This is a tidy neighborhood. This feels good. This feels connected. It's not because it has private gates or private roads or big fancy mansions. It's just because there's a connection and you can feel it. That's what Neighborhood Alliance is bringing to the city of Norman. We're very excited about it and excited about working with each of you individually in your wards. I personally will be meeting and setting up an appointment with each one of you so that I can learn more about your wards, your neighborhoods that are already there, and how we can enhance them and what your goals are for your individual neighborhoods. I'm open for any questions if you have any.
Councilmember Hall.
Thank you so much. Thank you, Ms. Rasko, for coming before us tonight. We've had the privilege of seeing your presentation several times now, and I wanted you to just speak briefly to the timeline that you're expecting and how this is going to be implemented this year.
That's a perfect question, and we'd hope to have somebody hired by now, but I just haven't found that right person. I've interviewed about 5 or 6, but looking for that right person. So I will send all of you after tonight a copy of that job description, and if you have any recommendations, please definitely send them my way. So our timeline is to get someone hired. We're not going to wait for everything until that starts. Our very first process is to get to know you as a city. Just like we don't organize neighborhoods by a city. In Oklahoma City, I have the problem sometimes until they were educated of council members calling me and saying, I want you to set up a neighborhood here. It doesn't work that way. That's not my neighborhood. That's not their neighborhood. It has to be more organic. They have to want that before it's ever going to be sustainable. So our first goal is to get to know you as council members, as department head leaders. What is it that you've already done? What's working great? Where are your problems that you'd like for us to try to work with? How do you think organized neighborhoods can help with that? So that will be an ongoing process between now and December to get to that. We will be, once we get the person hired, of course, we'll be introducing them around. We'll do a social media campaign in the city of Norman to let them know what's happening, what's here, what's available, how they can utilize us. Then we're going to start holding some focus groups within the city of your organized neighborhoods. Learn from them first. What have they done? What do they think that's been helpful? And then move it out and open it up to just citizens as whole, anybody at all that wants to come and learn about what an organized neighborhood or block, it doesn't have to be a whole neighborhood, could even be wards in this city. We're open to all of that. We don't know if we need coalitions, individual neighborhoods. We're open to whatever it is that's going to help you. So for the first, until December, it's going to be a lot of that. We're going to have a couple of workshops that we're working with Lisa and the planning department on between now and December to kind of show people what a neighborhood alliance organized workshop is about and how that happens. We always serve food at our neighborhood meetings. Food builds community. When you sit across from somebody and share a Panera lunchbox, somehow you're friends after that. So we'll get those kind of things going between now and then we're slowing down on what our plan is for January through the rest of that year until we figure out what you guys really need and want from us.
So one of the things that has caught my interest for quite some time with the work that you're doing in Oklahoma City, and something that comes up frequently here in Norman, is helping neighborhoods understand the difference between a neighborhood association and an HOA, a homeowners association. And I know that this is something that you address through workshops and other means on a pretty regular basis. So could you just give us a sample of what that's all about?
There are 2 different kinds of neighborhoods. As she said, there's the voluntary neighborhood, which is just that. You join if you want to. It typically doesn't have any set of covenants, any kind of rules. It's just a set of boundaries, and people get together and elect officers or leadership team, whatever they want to do in that. And we help them every step of the way in that. And then the other kind is a mandatory or a homeowners association. Those neighborhoods have much more fiscal responsibility, much more fiduciary responsibility, I should say. They have sometimes they have a lot of money running through them. They have legal responsibilities. You as a city are limited on what you can or can't do with homeowner associations. They can't bring their covenants to your legal department and say, we're not understanding this section. They can't bring their bylaws to you as a council person, even unless you live there, of course, and say, we don't understand these bylaws and we want to change them. You can't help them with that. Neighborhood Alliance can. I'm not an attorney, but for the last 20 years, I've been working very, very closely, and several of my staff have as well, specifically with the HOA population. So we hopefully can help them with those simple, non-legal, not needing to go to an attorney, maybe not even going to a CPA, kinds of issues that can help them stay organized, stay taking care of their common area, not have to go into receivership or have the city have to come and take care of their creeks or whatever is in their common area that really should be their responsibility. So we do a lot of that for the HOAs through workshops. They typically, not always, there are some HOAs in low-income areas, but typically HOAs have more of a capacity inside of their neighborhood. They have more lawyers and engineers and people that know how to run an effective meeting and how to make a strategic plan or do a budget. So we can do workshops for that population, and they typically can take that skill set and then do what they need to do with it. Whereas with voluntary, we do a lot of hand-holding, a lot of patience, and just a lot of work.
So one of the things that I'm really interested in the work that you're doing is there's a lot of difference between wards of whether you even have a choice of which path that you can choose. So for example, in Ward 4, the oldest part of Norman, I am aware of one HOA that exists in Ward 4. Everyone else has to go the neighborhood association voluntary route because we've been here so long that HOA wasn't an option to begin with. So this is really just my comment about this particular agenda item. This has been an initiative that I've been personally interested in for quite some time now. It's an initiative that Mayor Clark and I both have had a high interest in and was actually one of our council goals this year. So I'm so happy that we're able to accomplish that goal and also have it reaffirmed by the work of the mayor's task force this past summer. It was a very strong recommendation out of that task force as well that we pursue building a relationship with Neighborhood Alliance. And I really got my introduction into being engaged and find myself on city council because of my understanding of how important it is for building community within neighborhoods and for the strength that can come from a neighborhood to have a voice and speak up for the things that they need in their neighborhood. So I strongly support us moving forward and am really happy that we're moving in this direction. So thank you for being our partner.
Thank you, Councilman Hall.
Councilman Berlin.
Yes, Ms. Rasko, I'm sorry.
That's okay.
A few questions for you. Your website shows that it is neighborhood organizing and advocacy. What kind of advocacy?
We advocate for the needs of neighborhood. In Oklahoma City, our staff sits on a lot of the boards and commissions at the city, as well as the leaders that we've graduated from our leadership council training, so that they can represent the needs of neighborhoods on different city boards and councils if they have the right qualifications. We encourage neighborhoods to organize themselves if they need to go before a planning commission, for instance, or a board of adjustment. Instead of bringing 15 people and all getting up and saying the same thing, we help train them that it's most productive if you can go organize your thoughts. Each of you, if you select 2 or 3 speakers and each of them say something different as they get up there, those kinds of things so that they can really get their point across of what it is that they need in a more efficient and organized way.
In what I have here in front of me, that was one of your letters that you'd sent and is included in this packet. It had talked about it had talked about the last year and how it was difficult for everybody, and that you'd had some, because one of your other arms is working with the police, correct?
We have in Oklahoma City, we have a contract with the police department and the city of Oklahoma City.
And I know that we're just looking at the planning side here for Norman
Right.
at this time, but it says it can grow.
Absolutely.
Into that.
If the police are interested in that, you can't really have a neighborhood without them interacting with their police department. And so we would really love to be able to, and we're going to do that regardless. We're going to meet with your police chief and make sure that there's a connection there.
When you had dinners with the chief, it says it was limited to people of color. I think it was the words that were used in it. Because of the rough year that they had. That seems exclusionary to me instead of inclusive.
Yeah, that would be, absolutely, you're right. And I'm not sure where that came from, where I need to correct it if that's someplace. For one thing, we haven't had that yet. That's in our police contract, and because of COVID, last year we weren't able to organize that. It's a direct ask from our chief of police to help bring him closer to people that would never have had an opportunity to sit down and have dinner with the chief of police. So it's about selecting 5 to 8 different people for each of the dinners. There will be between 4 and 7 different dinners across the city. It will be the people included in those dinners will be people that have historically been disenfranchised from the police, not necessarily people of color only. Of course, people of color have been, but anybody that feels like they want that opportunity will have an opportunity. Background checks do have to be done as per the police's request in order to have those dinners. And then once all those dinners are over, we've completed all of them, we're bringing all of the participants back together to have an open conversation with all of the chiefs at the city of Oklahoma City.
And in that, because it's your words in here that it was with people of color, because
I'm glad you brought that
racial
up so I
tension.
can look for that.
I just feel that exclusionary, because I would like that opportunity if I was in my neighborhood and you were coming into my neighborhood and saying, hey, we're going to have dinner with a chief. But if you're just going to exclude it to people of color, just a decision made on the basis of someone's skin, this is not a program I can get behind. And with the advocacy part, I just feel like this is a political arm.
Of what? A political arm?
Political activism arm is what I feel like this boils down to, and it's being funded by the very government that it's going to come and advocate to. You might do great work and whatnot, but after reviewing this and looking at this, I don't feel like it's something I can get behind. I'm not sure that it's showing the need of why this is even necessary here in Norman. We are very different than Oklahoma City, and the neighborhoods. Maybe I don't know the neighborhoods that you've had this work in, but I'll tell you, there's a lot of not so great neighborhoods in the city. That's why I live here in Norman and not in Oklahoma City. They do some things that are amazing, and I would love to copy many things that Oklahoma City do here for this city, but I'm just my research in this right now, it's hard for me to get behind this because the advocacy part of it and the exclusion based on the color of skin that's in your own proposal.
I don't know that we proposed dinner for a chief for you. We're not doing that in Norman. That's not anything on our agenda at all for Norman. We're very aware that Norman is different. That's why I just said it's going to take a good 6 months and more than that for us to even get to know your structures, the people in your neighborhoods, what they even need. I can't walk in here today and tell any of you, other than what I've heard from city staff and the mayor, that this may be some things that would be that they need, but I haven't heard that from the citizens yet or from the residents. I've been in nonprofits my entire career, which has been over 35 years. And I'm very, very aware that as a nonprofit, I am not going to jeopardize my funding from anyone to be an advocate or to do political. That's just not what we do. So we try really hard to stay away from that. We only teach people how to be more effective in their communication. Either way, we don't tell them what to be effective on. They might want to fight something that's totally against my beliefs. That doesn't matter. My beliefs don't matter in that. It's what they want to do. And so that's how they work closer with you as council people as well.
Okay, thank you. While this is not proposed, it is in your proposal for Norman to do this, and it is an example. And it's in the building a stronger relationship with Norman police neighborhoods, and you give the example of what you're doing with the chief of police, is it Gurley?
Yeah.
And create 8 to 9 dinner with the chief events. We'll organize and invite 5 to 7 persons of color, or POC, however you want to say it, to have a restaurant dinner with the chief.
And I'm glad you pointed that out to me. That was an error on my part in putting POC on there. It is more disenfranchised people that have never met with the chief. That was an example of what we do with our police department, is what we were trying to show there. We don't have a contract with your police department, and I don't even know what your police chief's goals are at this point, but I will soon.
All right, thank you.
Thank you.
Councilmember Tortorello.
Thank you for clarifying that portion there. I did read the same thing too as well here, and it did seem, to exclude a lot of different people here, but
I can see that.
I think you made your point known that it's not for Norman. I guess, would you say this is a sample
Exactly.
program for us to look at what was done in a different city?
At the
Get it
time,
down?
your council members and the people on the committee were asking me what kinds of things that we do with our police department in the city of Oklahoma City. We're very, very involved in the police department and their entire community relations activity. We believe we organize the crime patrol and crime watch programs for the city of Oklahoma City. So it was an example of one of those things that we do for them.
Okay, that's all right. You clarified it, and that's good enough here. So what other cities have you done this, and how do you measure success?
That's a very good question. You are the first organization, or the first city that we're actually starting. We're going to hire an employee to be in a satellite office of sorts here. I have been a guest speaker on neighborhood and neighborhood leaders in Anchorage, Alaska, in Arkansas, and Dallas, in New York City, all over the country. I have at least 20 different national presentations that I've done on neighborhood organizing. Again, they're doing the study on us because OU then, after they realized how unique we were, they went out and studied themselves first before they got a grant to do a research project on it. And there's not anybody else that's like us. There's a lot of municipalities that do some of the things we do, but they do that within themselves, not as a nonprofit organization. So how to measure success? That's going to be up to your contract and what we have with you and what we do. Sometimes we have to start so basic with neighborhoods that our measure for success for them is to go out one year and see how many people are trick-or-treating on the street. Compare that to the next year. How many more people came out? How many people are walking the streets? How many moms and strollers are out there? We, of course, measure it in crime prevention, how many calls to the police, but of course, when you get more organized and you start utilizing police more, your crime stats might go up simply because you're calling more crime in. So you have to take all of that into consideration. But we will decide what you guys want as your measures of success, and that will be in our contract.
Okay, so basically what you plan to have is maybe like a town hall, and you invite everyone to come by and talk from different wards. So theoretically, you can have a different plan for different wards, correct? Going forward?
A different what?
You can have a different plan or program going forward for the different wards. Councilwoman Hall had mentioned that in Ward 4 it's different. So would all the wards have the same template program to start with, or would they deviate from that based on the input by the community? How would you determine how each ward, or is it a citywide thing?
It depends. There wouldn't be a different program for each ward because we need everybody to have a similar set of boundaries. But everybody can, all of this I'm going to say all of this, and none of this is set in stone because I haven't met with you guys yet to decide exactly what you want. There is the model that each ward kind of has its own ward council of sorts, and then they can have block associations or neighborhood associations within that, and then they're represented by a committee or a coalition. There's also we use that, we're just now starting with coalitions in the city of Oklahoma City, but all voluntary neighborhoods have their own standard set of how to organize. They can either have a set of bylaws that have an elected officers, or they can use a leadership committee. So there's lots of different ways that each voluntary neighborhood can choose to organize. We don't have one template and say, this is what you do, and this is how you do it. We have things that they have to have bylaws, because they have to have a system to run their association. They have to be incorporated, because they're going to need a bank account. So we help them with all of those things, but other than that, it's up to them and what their goals are in that neighborhood.
Okay, good points here. I have one last thing to kind of piggyback on Councilman Lynn about the organizing portion here. You had mentioned that you don't have a political affiliation, or you have nothing. You would offer assistance in how to organize individuals to go or pro or against certain things happening in the ward or with the government. What do you mean by that?
Strictly with neighborhoods.
Okay.
Strictly with neighborhoods. We don't organize individuals on how to pro or con anything. Let's say if a neighborhood has an on-queue being built in their neighborhood, they need to know how to advocate for that. They need to know what the city standards are. Is that an appropriate business for that? If it is, then what is it that they don't just have to throw up their hands and say, oh, on-queue's in our backyard. Now they can go and they can talk with on-queue individually and say, what we need is sound barrier between us and the houses, between you and the houses behind you. We need the lights to shine down on the parking lot only. We need no trash pickups before 9 o'clock in the morning. I don't want my sleeping babies to wake up to that beep, beep, beep. Those kinds of things are advocating for their own neighborhood, and that's what we help with.
What if there are two opposing views to the on-queue example? For example, what if they want an on-queue and you have a group that doesn't want it? So how do you deal with a dilemma like that?
We don't. We teach you how to do it.
Okay.
That's not my dilemma. That's their dilemma. It's my job to give you the tools and what you can do and how to reach consensus if it's going to be there, and it may not be there.
Fair enough. Thank you.
You're welcome.
Councilmember Studley.
I just want to say thank you. I'm really excited for this to come to Norman. I have some questions about how many staff do you currently have in Oklahoma City?
We have 6.
6, okay. And so the satellite office is just going to be one individual that's kind of here getting to know the community, but I'm assuming then a lot of the staff that's already in the city will be hosting like the online sessions.
Absolutely.
Okay.
Yeah, it takes a long time to really become a good community organizer that we represent. So it'll be a couple of years in training at least for the person that we get, but our entire staff in Oklahoma City will be at working on this project as well. But we will have a steady person that lives here that represents Norman on our staff.
Is there somebody that's gonna, from your current staff, that will kind of help guide one-on-one the staff member that you hire?
I'm going to be the trainer to begin with. Yes, I will be the official one to help with all of that and to help setting the organization up. So it'll be mainly me for first.
And the $100,000, Lisa, you mentioned that's actually from the general fund.
Yes.
Is that
Budget amendment.
okay?
Yes.
And is that something that covers the staff? Or what exactly does that cover, and what do you anticipate the cost moving forward?
I can answer that.
Okay.
So the contract that was developed was based upon the feedback that we got from the council from the couple of study sessions we had about the various workshops about neighborhood organization, officer training, as well as the ability to work with city staff to develop a roundtable for citizens to be able to come and meet staff. And so we were able to take all of these items, kind of had the goals of what we wanted to do. Georgie put the numbers behind it. And so basically we will be being billed for the events and the undertakings of the agency. The employee will be an employee of Neighborhood Alliance. Monthly we have a template that's been developed based upon the different events, whether it's a one-time charge or an hourly rate or things like that will be a monthly bill that will come to our office that we'll review before payment.
Okay.
So, okay. I do want to take the opportunity to say that, in all of my time here in Norman, the CDBG program has worked very hard to help organize the target area neighborhoods. It ebbs and flows, and it is very hard work, and I'll be perfectly honest, I am not cut out for it. My first call whenever I come up with a neighborhood problem that has been brought by the neighborhoods is to Georgie. for probably 15 years. I have her on speed dial. They have contracted with us to come in and do some specific events over time that have been very well attended. And more, our office receives inquiries from citizens about how do I organize my neighborhood. And, you know, my staff and I will sit down with them and get them the maps they need and give them the handouts from 2007 that I got from Georgie, and basically point them towards Neighborhood Alliance for assistance. They've been very gracious to kind of work some people in with them. But this is going to be kind of a game changer for Norman, I think, that if we start looking at the long-term effects of citizen organization within their neighborhoods and being able to actively engage with the council and city staff about issues with their neighborhoods. Like Georgie was saying, that your crime statistics may go up because people are reporting more crimes. Once we get over those hurdles, the benefits to the city is going to be amazing, because you will have informed citizens that no longer believe everything they hear. They know who to ask to get the correct information and can provide that information to their other neighborhoods. So,
okay.
Any more questions?
I just wanted to make a comment to the full gist of that paragraph referring to people of color having dinner with the chief. It said due to the racial unrest this year. And so that's why you were offering people of color to have dinner with the police. So I completely understand where you're coming from, and thank you.
Councilmember Holman.
Thank you. Appreciate you coming down to Norman as well. I think I can see, well, just one thing. On the agenda, it does say funded by Community Development Block Grant Funds for the Norman Neighbors activities. So
That was a mistake.
okay, just want to make sure that. So there are quite a few neighborhoods in my ward I know that I think could benefit pretty greatly from this. Some of which are newer neighborhoods. Some of them have very nice houses. But when it comes to operating an HOA and knowing what to do, how to protest or support development issues around them, I've seen that be an issue in neighborhoods all across my ward, regardless of income or property value. Some of the issues are, one particular neighborhood has several sections that have developed over the last 40 years. So some of the houses at the front of the neighborhood were built in the early 80s, and there's some that are, well, two of the phases were postponed tonight to add on to the neighborhood. And so each of those sections, a lot of those neighbors don't know necessarily how to organize themselves together to come to City Hall and give a presentation about why we shouldn't approve it or why we should. And so I think understanding local government issues, who your city council members are, who the mayor is, who the chief of police, who the fire chief is, those are all, I think, real important things and people to know that I think a lot of neighborhoods, especially ones that are brand new and being developed right now, you have people moving in, they don't know their neighbors yet. There may be an HOA, but it's brand new too, and so the president might, just be a guy that volunteered, And so, so I think this could be very beneficial, I think, for a lot of neighborhoods in my ward. I think one of the questions I had is, are apartments considered part of neighborhoods, or?
Well, of course, apartments should be a neighborhood. Every single, whether you're a voluntary neighborhood or a mandatory neighborhood, condominium, townhome, or apartment, you should be about one thing, and that's about creating good neighbors. That's all. That's our answer to, if we can bring everything down to, is this creating a good neighbor? Then we know our agency's on the right path. So we've had some apartment managers, absolutely, and some trailer home managers contact us, and we've helped them create citizens, I don't want to use the word citizens, residents kind of associations, because they do have a pretty strict management organization already in place typically.
There are a lot of apartment complexes in my ward specifically, and I've heard over the years from residents that say, I live in an apartment, I'd like to be able to get more organized with my neighbors and, have some more functional, like some of the neighborhoods do that have homes and stuff. but a lot of them haven't been able to find those resources. So I'm kind of
We'll help
hopeful
'em.
that Neighborhood Alliance might be somewhere they can go in the future.
Absolutely.
Okay, well, thank you so much.
You're welcome.
Councilmember Schuler.
Hi, thank you. Thank you for this presentation. I'm newer to council, but excited for this, this coming to us and the work that, Mayor Clark and Councilmember Hall have done on this to have moved this forward with Norman. And I think that as, Councilmember Holman was talking, and just like Councilmember Hall, I think Ward 2 has many neighborhoods where an older part of the city as well that could really benefit from having some organization like this. And really, I just wanted to clarify the proposal that some of my other council members were reading from wasn't what we were going to do in Norman. It was really just what we could do in Norman. Is that correct? Like, these are opportunities that we could
Absolutely.
implement in Norman. This wasn't the proposal saying these are all the things that we're going to do.
No, you're right.
Correct.
This was just what we have done, what we could do to dream from. Like I said, we don't know what you guys really want yet. We really can't, other than the town hall meetings to get to know that. I'm hesitant to plan anything specific for your city yet until I hear from your residents.
Sure. I just wanted to clarify that
Thank
it
you very
wasn't
much.
just this is exactly what's already happening and in the works, but that we're developing things and we're in the process. And so really this is just creating the contract for us to develop all of these programs for our community.
Yes, and your program, I know, will look very different than the city of Oklahoma City's, especially in the next few years as it develops.
Yeah. And I also just want to say that I really appreciate what you do in organizing, neighborhoods and communities to advocate for themselves and to give them the resources and the tools on how to come to city council, because that is not something that is easy to always navigate. There are lots of moving pieces. There are a lot of players. There are a lot of intricacies
Emotions.
that can go into that. And I do some of that work with students, and so I know how challenging that can be, and to be in kind of a nonpartisan space and not advocating for one position or side. It's really just about resources and tools, and giving people the knowledge that they can go forth and do what they need to for their own needs and wants. So I
Thank
just
you
really
for that.
appreciate
It is empowering,
that.
isn't it? When you find out that you can have a conversation with your mayor and have it on a even keel level. You're not yelling and screaming at them, but you're having an actual conversation. That's very empowering.
Thank you so much.
Thank you.
Councilmember Peacock.
Thanks. Yeah, just as somebody who grew up in Oklahoma City, I've seen a lot of your work firsthand.
Good.
I just want to say that I'm extremely excited to have you guys down here, and kudos for everything you've gotten accomplished so far.
Thank you. Thank you for that.
Georgie, I just want to say thank you. We have been talking about this for a long time. The mayor's task force was last summer, and I first met with Neighborhood Alliance as a council member. So this is such an exciting time to see this amazing program come to our community, and I know you're going to do great things.
Thank you.
To be able to empower our residents to not only know their local government, but engage with it is huge. And it's exactly the kind of advocacy that we need in our community. So thank you so much, and I look forward to working with you.
Thank you. Same here for all of you.
Okay.
Thank you.
This is now an opportunity for members of the public to make comments regarding this item. And just a reminder, public comments are limited to 3 minutes. Okay. Any other public comment? All right, seeing none, the motion on the floor is to approve the contract. Council members, you may cast your votes.
All votes have been cast, and the motion to approve the contract passes by a vote of 7-1. Voting against, Councilmember Lynn.
Thank you. Item 53, a resolution granting a partial exemption from current subdivision standards for sidewalks and curb gutter street widening along Oklahoma Avenue in the Cinnamon Creek Addition 1811 Oklahoma Avenue. I'll entertain a motion to adopt or reject the resolution.
Motion to adopt.
Second. Thank you. Is there a representative of the applicant to make a presentation on this item and the following one?
Evening. This is about as,
Can you please identify yourself?
I'm sorry, Richard Ewald.
Okay.
I'm the project manager for Centerline Services. The owners of Cinnamon Creek Apartments, longtime owners, a couple of decades, on the east side of this tract, when the property came for sale, the 1.87 acres to the west, single-family home on Oklahoma Avenue, they purchased the property with the intent of selling the house, and then it's unplatted, it's meets and bounds, there's a single-family residence to the north, there's single-family residence to the south, and they wanted to do the right thing, so they're going through the platting process. And so what we've done is we've matched the property to the south in size, and what we're doing is separating. So the single-family residence on the west would be Lot 1 platted to itself, and the remainder of acre and a quarter, which is east of the creek, would be combined with the apartment complex. It just makes sense. There's no plans for construction, future, ever. No changes to the water, the sewer, the drainage, the streets. As far as the exemption from standards, there's no sidewalks to the north or the south. There's no curb and gutter. It's a nice, quiet little street. Everything will stay the same. We're just consolidating the 0.6 of an acre. That would be Lot 1. The single-family home would be available to be sold, and the open space in between the apartment complex would be combined with the apartment complex. And now it would come under, it'd be mowed and maintained by the Cinnamon Creek, the property owners. Oh, excuse me. Questions, I guess?
Councilmember Hall.
Thank you for coming tonight.
Sure.
This is a project in Ward 4, so it's one that I've been following very closely. It's actually been rolling around since last year in October. Was the first time that the neighborhood got a notification about what was going to be happening with this particular project. And I think in working with the neighbors and working with the applicant, what we discovered is what you have laid out, but I just want to make sure that we all understand what's happening tonight. And so you've gone through the process, we're ending up here in front of council, and your intent, as you said, is to preserve the zoning for that front portion of the lot at 1811 Oklahoma, correct?
Yes, ma'am.
Yeah. And are you going to sell it? Are you going to try to renovate it in any way, or is your intent to not hang on to that parcel?
The house is probably at least 80 years old, extensive renovation. I think there was an offer, but that's, like you said, it's been a year. I don't know. I think he might have moved on. Basically, what we're doing is this platting process is, like I said, it would match the property to the south, to the north, and he would put it back on the market, and but it would stay as single-family home.
So anybody who purchased it, if your intent is to sell it, anyone who purchased it, they would be purchasing an R1 parcel.
Yes.
And then it would be up to them what they chose to do with whether or not they wanted to renovate the home or, do something different, but they would be limited to R1 zoning.
Yes, ma'am.
Yeah. Okay, so this first item is concerning the easement, or the, you're trying to get a partial exemption. So I just wanted you to help me paint the picture of what's going on in that, not only on that street, but in the neighborhood. So according to current building standards, you would be required to put in a sidewalk. And so you're asking for an exemption from doing the sidewalk, correct?
And the reason for that is there's no sidewalk to the north, there's no sidewalk to the south. It would connect to nothing. And so basically what this would do, like I said, single-family north, single-family south, no changes whatsoever. As you go further south, the university has purchased that, and they're running a warehouse district, but they've got a parking lot and all that stuff all the way down to the end of the block. So this would actually be no changes. There's no physical changes. It's just moving, once again, it's just defining a lot line and platting this so that this could be separate. It was almost 1.9 acres.
Mm-hmm.
And it went across the creek, so what we're doing is platting what is contained within the fences and is a single-family home.
Because of the age of the neighborhood and the way that the streets are constructed right now, you're just maintaining the status quo.
Yes, ma'am.
And it would be really odd to go in and put a sidewalk. And the reason I'm bringing this up is because there's so many people that are clamoring to get a sidewalk that in this particular instance, this definitely fits in with the character of the neighborhood, and you just have to get an exemption because of what is currently in place.
Yes.
Yeah. So the lot that, the back, the eastern portion of the lot, that's in the floodplain, correct?
A portion of it is, yes. That's where the creek, the fence is on the back fence, the east fence for this single-family home is up on the top of the bank, basically. And, but they never went back, they never mowed, they never maintained, it was just left to its own. And so that's why when the owners purchase this, they want to separate it. Single family goes this, the acre and a quarter of the wild stuff, open space, stays in open space. They'll just maintain it now. But it'll be added on to the apartment complex, what it does is it abuts, they have an existing community garden. They also run their own, they grow their own shrubbery, that sort of thing for so they have no plans for construction. It's merely to consolidate it and to get the other one. To get the other property, it could be put on the market, like you said.
Because on the eastern side of the creek, it already is a designated open area, as you just described.
Right.
Yeah. So I just wanted to take a moment to clarify, because really both of these items are really just a cleanup item to get the property kind of where it needs to be for the current owner, and there is no intention to build, as you've said. And if the owner would decide down the road that they wanted to do something, they would have to come back and do the same process all over again.
That's what we understood. This is merely consolidate, simplify, and if like this lot one for the single family home, if it was sold, they would have to go through the whole permit process.
Okay.
And, that's on to them. But as it is now, it'd be the status quo. We would just be defining lot lines.
Well, because there was so much interest in the beginning from this neighborhood, I just wanted to take this opportunity to clarify that there really is no adverse effect by what you're requesting tonight on the neighborhood. So thank you for answering my questions.
Thank you.
Thank you, Councilmember. This is an opportunity for members of the public to make comments regarding this item. Are there any public comments? None registered? All right. This is an opportunity for council to make final comments regarding this item. Seeing none, the motion on the floor is to adopt the resolution. Council members, you may cast your votes.
Thank you.
All votes have been cast, and the motion to adopt the resolution passes unanimously.
Thank you. Item 54 is consideration of a preliminary plat for Cinnamon Creek Addition, generally located at 1811 Oklahoma Avenue. I'll entertain a motion to approve or reject the preliminary plat.
So moved.
Second.
Thank you. This is a companion item to the previous item. Are there any further questions from council regarding this item? Are you pushing the button? Okay. Sometimes it doesn't work. I just had to check. Are there any further public comments regarding this item? Seeing none, the motion on the floor is to approve the preliminary plat. Council members, you may cast your votes.
All votes have been cast, and the motion to approve the preliminary plat passes unanimously.
Thank you. Our final item of the night is miscellaneous discussion. This is an opportunity for citizens to address City Council. Remarks should be directed to council as a whole and limited to 3 minutes or less. Madam Clerk, do we have any speakers?
And we have two tonight. George Oxen is the first speaker.
It's way down there. Hi, my name is George Oxon, 321 Ore Drive, Ward 6. On June 22nd, 2021, and on June 29, 2020, the City Council passed Ordinance 2021-45, prohibiting the practice of conversion therapy on minor children by a medical provider licensed by the state of Oklahoma, but does not include pastoral counseling by non-licensed medical providers. Once again, the City Council of Norman has put the children of Norman at risk and strengthened the grip of the reach of the LGBT community into the lives of vulnerable children who have been and are being groomed by the homosexual community, both in the schools and in the media, without any concern for the long-term psychological and physical damage that has and is being wrought in those young lives. As hormone blockers and even sex reassignment surgery could be discussed without parental consent. As a result, a good many of these children will be sterilized by a surgery or a lifestyle that in the end will leave them alone and confused, if not abused, by a predator, or living a life that was portrayed as a fairy tale, but in the end could be a tragic nightmare. In California, SB 145 was introduced by Assemblywoman Susan Eggman and State Senator Scott Wiener. That bill would explicitly exempt sexual predators who are within 10 years of the age of the victim from automatically having to register as sex offenders in the state official database. According to State Senator Wiener, SB 145 would eliminate the discrimination against LGBT youth in the criminal justice system. The ordinance she passed is nothing but a stepping stone for more blatant and more destructive ordinances. By your actions, you are letting children be groomed by pedophiles and predators, all under the lie of equality and inclusion, when in reality it is delusion and contempt for the nature and nature's God. As a result of the council's decision, I will be working to unseat those who voted for this ordinance. It is time to combat the sexualization and exploitation of children. The truth is, everyone on this planet will have to deal with a living Almighty God. So thank you for your time.
Thank you.
Our next speaker is Catherine O'Brien. I think she might have left. She was the one that... Okay, that's it.
All right.